in the preparation for today's podcast, all about sleep, which we're going to take people through a whole sort of masterclass on this topic. You wrote in the note that sleep is the most underrated and underappreciated aspect of health. Number one, obviously you feel that's true because you wrote it, but tell us why.
Yeah. So first of all, thanks, Drew, for having me here. It's a pleasure to be with you. And, sleep is pretty amazingly important for so many different aspects of our health. And I think it's one that really takes a back burner. And I think it's one which is really kind of a bellwether for how out of balance we are as a culture and, our bodies and our health. We're so busy. We're so stressed out. We have so many things that we juggle. It's just go, go, go. From the moment we wake up until the moment we go to bed, we're all on our screens. And so, this element of properly preparing for sleep, which really begins the moment you wake up, is lost. And I don't think we're paying attention to it. I don't think we're focusing on it. And I think that with some pretty simple techniques and habits that we can discuss today, I think we can really change that with profound implications for our health.
Yeah, and I think the important thing to talk about when it comes to sleep is that we want to focus so much more on the things that we think are sexy that are out there, right? People want to focus on what's the latest and newest supplement that's out there? What is the food that I should be eating or not be eating? What is this some new therapeutic that can radically change my life? But we forget that if sleep was a drug, it would be the number one most successful drug in the world. And
Absolutely.
That's why you wrote that it's the most, I'm going to read it again because it's that important. Sleep is the most underrated and underappreciated aspect of health. You see patients all the time at your clinic, the California Center for Functional Medicine. Link in the show notes if people want to check it out. But how many times do people come in and they're complaining about one other thing, or they're trying to get that last 10% together right in their diet, or they're worried about what is the right supplement to take, but you find that just getting their sleep a little better has the most profound impact on their health?
Yeah, I would say that's absolutely the majority of our patients. And it goes also for the fact that it's patients who I've been seeing for a long time. It's not just new patients. Sometimes I'll have a patient who I've been seeing for a year or more, and I'll dig back in and say, okay, wait a minute, what's happening with your sleep? What time are you going to bed? What's your nighttime routine? What's your morning routine? What's your, use of caffeine, et cetera, throughout the day? And just realize, whoa, okay, we need to regroup on this and we need to really dial this back in because it slipped, from all the things that we're juggling. And so absolutely, new patients, the vast majority have issues with sleep, and as well as ongoing patients. It's something we all have to remind ourselves of, even myself. When I try to dial in my sleep and I do a good job for a period of time, and then I might get a little lazy or I might get on my screen again in the evening time. And before I know it, an hour has passed. And so it really takes focus and consistent effort to make sure you're staying on target.
So most people know who are listening today that when they don't sleep, they don't feel good the next day. That can show up in a bunch of different reasons. But I want to take the first part of this podcast and I want to really tease out some of the bigger reasons why sleep is so important, right? Again, we don't sleep well. We don't feel good the next day. We don't focus as well. Maybe we're a little bit more hungry, but there's a whole bunch of other things that sleep is deeply tied into. And you put together a series of fantastic notes that I'd love to walk people through. And for anybody that's interested on how to reduce their risk of Alzheimer's, cancer, cardiovascular disease, pay attention because we're about to go immune system. We're about to go deep into it. Okay, so let's go on the first one. Alzheimer's disease. This podcast was originally called the Broken Brain Podcast, and it was all about how to not have your brain broken and that your brain isn't broken if you do the right things. So people are very interested in brain, cognitive health, and reducing the risk of Alzheimer's and dementia in the future. So tell us, what do we know about Alzheimer's disease and its relationship to sleep?
Yeah, so if you're not sleeping properly or adequately, you have an increased risk for dementia and for Alzheimer's disease. Sleep problems precede a formal diagnosis of Alzheimer's for many people by many years. And over 60% of Alzheimer's patients have at least one clinical sleep disorder. And so there's a bidirectional situation that's happening there. And additionally, if you're getting decreased sleep, you have a decreased ability to clear beta amyloid in the brain via the glymphatic system, which is like the brain's lymph system. And the glymphatic system basically opens up, and that drainage, that detox, that movement of toxins out of the brain is much more active at night if you're sleeping.
Yeah, people have heard about it before on this podcast, but your brain has its own detoxification system,
which is active at night much more than during the day. And so if you're skipping out on sleep, you're not getting that flushing of those toxins from your brain.
It's like the example that I've heard functional medicine doctors like yourself say is that at night is kind of when the city's asleep and all the trash collectors go around.
That's so right.
And they're picking up all the trash that's out there.
Yep. The streets are quiet, not a lot of traffic. And yeah, exactly. I like that analogy.
And your brain can do its job. But if you're not sleeping well, and if you're not getting deep sleep, then your brain's detoxification system, which you mentioned is called the glymphatic system, can't do its thing.
Exactly. Yeah. And it goes the other way too. So beta amyloid can accumulate in the medial prefrontal cortex region.
And just as a reminder for people, because sometimes new people are listening to the podcast, what is beta amyloid? Why is it so important when it comes to cognitive decline?
So beta amyloid is one of the key proteins that can accumulate in brain cells and cause damage. And we don't totally know, is the accumulation of the beta amyloid, is that deposition itself the primary factor, or is there some other process that's going on that's causing that deposition? But we do know that this is one of the key findings with folks with Alzheimer's. And again, we do see that, accumulating in the medial prefrontal cortex, which is a very important part of the brain that initiates deep non-REM sleep. And so then you get this sort of worsening cycle as you head down this pathway. You further exacerbate or lose that ability to get that deep sleep, which is so healing and so cleansing.
Yeah, is it fair to say like the beta amyloid is like the rusting of our brain, sort of?
I would agree with that. Yeah.
Right. It's almost like rust on metal, and it's wear and tear. But also, the question that you brought up was in sort of neuroscience and people who are doing research on Alzheimer's. For a long time, they thought, wow, if we develop drugs that get rid of this beta amyloid, then maybe we can reverse Alzheimer's.
Right.
Maybe we can get to the root of it.
Right.
But that didn't turn out to be true.
Right. It's a very classical myopic, magic bullet approach that conventional medicine takes. It's attractive because then you have a drug which you can patent and market. But as our good friend and colleague Dale Bredesen, who I know you've had on your show, as he says, it's not if you think of as the beta amyloid deposition as one hole in a roof where you have a leak now, you can't just plug that one hole. There's probably like 36 different holes that need to be plugged, right? And so we do know that that's one part of the pathophysiology. But yes, as you said, that didn't pan out to be a magic bullet. So back to the drawing board.
Back to the drawing board. You mentioned sleep disorders. We're going to do a little deep dive on that, but just talk about some of the common sleep disorders that are out there that, you mentioned that 60% of Alzheimer's patients have at least one clinical sleep disorder. So it's the association between the sleep disorders and Alzheimer's.
Right.
So what are some of the common sleep disorders that are out there?
Yeah. So some of the most common sleep disorders that we really think about, and there are many, right? So, there's a variety of different sleep disorders. These are basically conditions that affect your sleep timing, your sleep quality, your duration, the ability of a person to properly function when they're awake. The American Academy of Sleep Medicine has a international classification of sleep disorders, which lists 60 different specific sleep disorders, each with its own set of triggers, of symptoms, of physical and emotional effects. And most, can be characterized by a core set of signs, which is trouble falling asleep or remaining asleep, difficulty staying awake during the day because you're so tired, sleep-wake cycle imbalances that interfere with a healthy sleep schedule, or unusual behaviors during sleep. Some of the most common sleep disorders include insomnia, which has a variety of different flavors or different subtypes. Sleep apnea, which is surprisingly common and very, very important to diagnose for a variety of reasons. We also, restless leg syndrome is another common one. Narcolepsy is another common one. In my prep for our talk today, I was thinking, focusing mostly on insomnia and sleep apnea, which I think are two of the most common.
Yeah, and we'll break those down. So, just to tie it all together, if you have a sleep disorder, it seems that there's an association where you're more likely, to develop Alzheimer's. But the thing is that even if you don't have a diagnosed sleep disorder, which sleep disorders are tremendously underdiagnosed. Even things like sleep apnea, we're going to talk about that later on. It's not just the heavy set, overweight male, older male. There's a lot of young people.
Neck, right? Yeah.
Right. There's a lot of young people that are dealing with
who are dealing with sleep apnea.
Who don't snore, who are dealing with sleep apnea and things like that. So there's a bunch of people that were in this range of subclinical sleep disorders that, again, you're increasing your likelihood of something negatively happening to your brain in the future if you don't get to the root cause of it.
Again, yes, happen to your brain, also happen to your metabolic system, happen to your immune system, happen to your risk of cancer. The list goes on of the things that your risk goes up for. Your mortality goes up, and so your lifespan shortens. If you're not getting proper sleep, and it's I think of it as sort of a one of the things I'm super passionate about with functional medicine is it's not like, you either don't have it or you do have it, right?
Right.
There's this continuum that's happening, right? And so with all these conditions, if you back up and look from the 30,000 foot view, if you're not sleeping well and you're not sleeping enough, right? You're pushing your body through many different pathways towards imbalance, towards illness, towards these clinical conditions of which there is a long list, right? Your inflammation goes up, your immune system surveillance goes down, your brain detox, as we talked, goes down. All these factors that are in play, your hormones become imbalanced, your insulin, leptin, ghrelin for satiety and hunger, and blood sugar balance, they go wacky, and so all these things are pushing. It's not like either yes or no. It's like you're tipping towards that, but you can pull back, right? If you really dial in your sleep and you get the right treatment and diagnosis and lifestyle happening, you can reverse that. You can peel that risk back and really do. And so we started off the podcast. Why is this so underappreciated or under recognized? It's because I don't think that people really understand the vast implications and the vast connections of how many things are dialed in with how you're sleeping, right?
Which is why we're going through this section. In a way, it's kind of like sound the alarm a little bit.
Yeah, absolutely. Exactly.
Not here to fearmonger, but also here to say, like, this is how important sleep is. If you have not been paying attention, there's always that, there's these different memes that are on the internet. It's like, if you're waiting for a sign, this is it. So if you're waiting for a sign to get serious about your sleep,
this is the sign.
This is the sign. All right, let's go to the next one. Cancer. One of the most scariest. Alzheimer's probably right up there. Cancer, also very scary disease. Tell us what we know about cancer and sleep. In particular, I was astonished to hear and kind of reading your notes in the preparation of this about how sleep was identified as for night shift workers, right? Night shift work itself was identified as a probable carcinogen. Tell us about that by the World Health Organization.
Yeah, so that's an important fact, and I just want to repeat that, which is that the WHO has classified shift work as a probable carcinogen.
So these are people, doctors, nurses, firefighters, police officers. These are people
anyone who's working the night shift, who's
working
trying to switch their circadian rhythm from day to night. And usually it's not like you're working every day. So then you try to switch back for part of the week so that you can be with your family and your friends and have a quote normal life, right? And then you're going back into that night shift mode. And so these are people also on call. So there's sleep disruption, there's loss of sleep, but that switch of trying to basically strong arm your body and brain from a daytime circadian rhythm, which is extremely hardwired, going back forever, right? We're active in the day. We're not nocturnal beings, and so our entire brain is dialed for that. But when you try to switch that, it causes a number of different disruptions in the body, which can lead to cancer. And, this is one area that I'm super passionate about. We've done a lot of work with first responders, with firefighters and police. And
through your clinic, you mean?
Through our clinic, yeah. We have a program called Protect Wellness, where we put them through a 4 to 6 month long comprehensive health program, wellness program, to really target some of the key areas that are causing increased mortality and morbidity. I don't know if you know, but the top 2 ways that firefighters die are cancer and suicide.
Wow.
Right?
I didn't know.
And suicide is a top killer for all first responders, across the board, firefighters, police, medical, veterans, it's just so, and that risk, we can touch on that later, but there's also, the risk of psychiatric disruption is also greater with sleep disruption. But to your question, going back to cancer for a sec, again, shift work, that disrupted circadian rhythm. In fact, Denmark actually pays women who had to work night shifts. If they get breast cancer, it pays them workers' compensation.
That's crazy,
isn't
right
that?
There, right? Like,
right?
that's just nuts.
Right.
Well, hats off to Denmark.
Right.
But also, how crazy is that? And today's podcast is also about it's sounding the alarm, but also, you're a doctor. I'm sure at some point in time in your career, residency, whatever it might have been, you were probably working at night, right? You probably are doing some sort of shift work in your rotations or whatever it might be.
Yep.
And so there's some aspects of life that are just there. They're gonna have to be there. And we're doing our best in between to minimize the damage.
Totally.
Or if it was something that we did in the past, we're trying to correct that by being even more serious about our sleep now, right? We can't change the past. You might even be in a situation where you have to be a shift worker, a nurse, a patrol guard, something like that. But at least when you can, you get serious about your sleep for the protection of your health and also for the protection of your family's health too, because they depend on you.
Yeah, exactly. Yeah, that we could go deep on that actually. Some of the thoughts and ideas that we've worked in collaboration with firefighters to try to build them a more nuanced schedule and sort of interventions. For example, and for to your point, in my medical school and medical residency, so many disrupted nights of sleep, and it still affects me to this day. I still am, I would, I'm not an awesome sleeper. I'm a light sleeper. I get disrupted easily. But I've done a lot of work on myself and using wearables, using devices to show me the data, and playing around with the different permutations of interventions, right? So. But for shift work, for example, we can spend a minute on that. On any shift, if you're up all night, there's kind of a fork in the road when it comes to the morning time, right? Did you have a super busy night where you got very little sleep, or did you have a quieter night where you got a decent amount of sleep? And that dictates what you're going to do that day, right? So if you got a decent amount of sleep, you might go home and, go exercise, have breakfast, hang out with your family, get some, errands done, etc. But if you really just got trashed and didn't sleep at all, you need to rest, right? And so we actually have a decision point in our work there with the firefighters and the police. It's like, okay, make that decision first thing in the morning. What are you going to do when you get home, right? So first thing, make sure you're safe getting home. Like the risk of accidents is way, way higher. It's been documented in many studies.
When you don't sleep, your risk of an accident is higher.
Absolutely. Yeah. Cardiovascular events and heart attacks and accidents are some of the two most, concerning areas. But so with shift work, if you had a difficult night and you didn't sleep much, we actually say, okay, when you're driving home, again, assuming you're safe, rest if you can't, drive home safely first. Then you drive home, but put your blue light blocking glasses on while you're driving home, trying to keep your brain thinking that it's still, not time to wake up, right? Trying to block a little bit of that blue light from hitting your eyes. And when you get home, have a little bit of water, maybe a light meal if you need it, or don't, if you can avoid it, and go and sleep. And don't sleep for too long, sleep for 2 or 3 hours and get that recharge, and then get up and treat that day as a very delicate day where you're not going to go big. You're not going to go for a big mountain bike ride. You're not going to exercise hard. You're going to try to avoid stressful situations. You're not going to drink alcohol. You're not going to eat sugar. So these are all other factors which are stressors on the body, right? So you really just pay attention to the whole menu, if you will, of what things are going to cause my body as an organism stress. And you really try to minimize those, right? And then the next day, hopefully, you go to bed early, try to get that recharge on a normal cycle. And the next day, you go about having a normal day, right? But then as you're preparing for your next call day, you also go into that reset resilience mode. And so you avoid all those stressors, right? You get up early, you get some morning light, you exercise, you avoid alcohol, you avoid sugar, you eat a healthy diet, you time your meals right, all that stuff, right? So you can really sort of create this on-off switch of all the factors that we can control. We rely on our first responders and our medical workers and all these folks who are working overnight. There's not really a choice of do you or don't you have them do it. But there's a lot of variables along the way that you can play with and mitigate from a lifestyle or functional medicine point of view.
It's a great reminder, and I love that protocol. That's awesome. That's going to help a lot of people. All right, let's talk about natural killer cells as it's related to cancer, because that's another thing that sleep does. Can you chat about that?
Yeah. So natural killer cells are sort of this roving, part of our immune system that goes out searching for things either to kill, bacteria, fungi, viruses, et cetera, or also for cancer cells, for aberrant cells that shouldn't be there, right? And studies have shown that just with one night of poor sleep, you actually see about a 70% reduction in the activity of these natural killer cells. So pretty profound of just that surveillance system. And I think this is for a variety of reasons. There's, the immune side of it, but there's also the hormonal side, right? So not sleeping is a stressor on your body, and therefore we are going to have an increase of cortisol and stress hormones. And this part of your immune system, much of your immune system is most active at night, similar to the brain lymphatic system, in part because that's when your cortisol is the lowest. And cortisol, as we know, from taking a steroid, is suppressive to the immune system. So cortisol is low, immune system comes up. The tone of the immune system, these cells are actually is what's called diapedesis. They're roving through the walls of vessels and kind of moving through the vessels and cruising around looking for these aberrant cells and again things that shouldn't be there, and taking care of them, eliminating them or calling in a signal for other immune cells to come. So that decrease of those natural killer cells is pretty profound. They've also shown, in a mice study, that the cancers of mice who were sleep deprived grew 200% faster than those mice who had been receiving adequate sleep. So there's a variety of different research in this area, which is pretty important and telling. And again, multiple pathways, right?
All right. You were talking about our immune system. There's other data outside of cancer that's related to sleep and the immune system. And again, our goal here is to give you a sign, to give you a reminder. We're not sharing anything on this podcast here that people don't know about. But in one podcast episode on sleep and really diving in and presenting this masterclass, the goal is to remind you to take something that we don't often take seriously or don't take seriously enough. And there are so many forces in our modern life that are working against having good sleep. So that's another reason why we need that reminder to pay attention to the basics. So let's talk about sleep and the weakening of our immune system.
Yeah, no, I think that's a great segue. I don't like to scare people. That's not my style. But I do think it helps to know this information, right? And to have it in front of us and to realize the depth of the importance of this. Again, from how we started this discussion, sleep is kind of taken a back burner and we've kind of forgotten, it's almost like, a pain to have to sleep so much, right? So, so more productive or people who need less sleep, some people might look at them and say, gosh, I wish I didn't need as much sleep to function because I would get so much more done, because our society is very achievement oriented and it's very, get more done oriented. It's not focused on the rest and reset and, community aspects, right? So, but yeah, so weakening of the immune system, studies have shown that people who sleep 5 hours on average were 250% more likely to catch the flu than those sleeping 8 hours per night with an identical exposure protocol. And we've seen that in a lot of different studies. Your resilience to external pathogens or coming down with a sickness when you have been exposed is definitely higher if you're not rested.
I see this a lot there's friends of mine who have kind of persistent canker sores, right? And usually the first sign of their canker sore coming up is 1 or 2 nights of not great sleep.
Yep.
And then a canker sore, which is a herpes virus? Is it?
There's a variety of viruses, but frequently, the herpes viruses is a very large family. So there are many different ones, but yes, frequently caused by a virus.
But it's a virus.
Mm-hmm,
and so that virus can, kind of like in the world of functional medicine, the thought is that when the immune system is weakened, then viruses that are there in the body, it's not like you contracted a new virus, they can sort of show themselves and express themselves. Yeah. And that's one way And for a lot of people, that's the earliest sign, the canary in the coal mine, that they need more sleep if they specifically deal with this persistent sort of canker sores or cold sores.
Absolutely. Yeah, that's a great example. Yeah, so many viruses enter our bodies, infect us, and then never go away. And, they're in their dormant state. One of the most common, two of the most common examples would be shingles, right? With the varicella virus, and then cold sores or, genital lesions with herpes simplex, usually herpes simplex 1 or 2 viruses, right? So yes, under stresses to the body, whether it's sleep or whether it's psychological or whether it's sunlight stress, right? Stress of sunlight sometimes can activate herpes viruses, et cetera. Those viruses are more than happy to come out of their box and reactivate. And we see that, those are simple examples. It gets a lot more complex. There's been a lot of research on HHV6 with ME/CFS, chronic fatigue syndrome. And then this, sort of big back and forth discussion of what is or is not happening with SARS-CoV-2. But there's some very compelling evidence that virus is also has the opportunity to be persistent and to reside. But yes, those viruses, again, are going to be there. And then anything that stresses you, whether it's lack of sleep, the canker sore example, some people also experience chemical stressors. For example, a toothpaste which has sodium lauryl sulfate in it can be a trigger. So sometimes that's one of the first things I do is say, get a brand of toothpaste that does not have any sodium lauryl sulfate. And some people experience that as a benefit. But yeah, they're basically just kind of just under the radar. And in my opinion, like a canker sore or those kinds of things where they're poking their head up again are kind of like the warning light on the dashboard of the car. It's not the indicator that the canker sore is the problem necessarily as the primary problem. It's more the indicator that the allostatic load on your body has gotten too high. And now you're manifesting symptoms from those underlying issues.
Allostatic load. Can you explain that for people who aren't familiar?
Yeah. So, the way backing up for a second, the way I think about that is that it's pretty amazing to me how much our bodies can handle. We throw a lot at our bodies, at our brains. We live so far out of balance from where we evolved, right? With our routines, with our, community isolation for a lot of people, with the food that we're feeding ourselves, with the screen exposure, with the pollution. I mean, the list goes on, right? So those all contribute to this allostatic load of what our organism is feeling and dealing with. And, basically when that passes a certain threshold, then you start to have reactions, whether they're psychological, whether they're physical, and stresses, trauma. Again, if we think about the first responder example or the medical worker example, there's little t trauma and there's big T trauma, right? But those all contribute to this allostatic load, which is sort of like this backpack on our shoulders that we're carrying, right? And so we have the opportunity to make choices which load that backpack up, or to make choices which unload that backpack and make our load a little lighter and give us the opportunity to carry forward more easily.
The other example that you often hear in the world of functional medicine when doctors like yourself are explaining to patients, it's like, okay, we all have a cup, and then that cup gets filled up with water. Now, water is a good thing, but imagine that the water is polluted, and the water in this case is like processed foods, alcohol, then you have a little bit of other stuff, and that cup drip, 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 builds up. And then you have a period of your life, which, we'll chat about this a little later on. There are genuine periods of your life. You have a kid, you're not sleeping as much, other things like that. There's things that you just can't avoid. You're not always going to have perfect sleep. But when you can control things, which is the vast majority of the time, if you don't focus on healthy sleep hygiene and sleeping well, and you have poor sleep, that's another load that's there to the cup.
Yeah.
And all of a sudden one day, your cup overflows and you go to the doctor's office because, knock on wood, I hope this doesn't happen to anybody, but we know out there it does. Somebody finds a lump in the breast tissue or in the prostate, or somebody, gets this diagnosis that their memory is not doing well and they get sent in for, do they have Alzheimer's? And it turns out yes, or they have a heart attack. So our cup fills up, and then it overflows. And that's what we call disease when it overflows.
Right.
But it's been building up this whole entire time to these contributing factors. One of the main ones being sleep. There's another thing that you mentioned about sleep, is that you talked about getting the flu, but also interestingly enough, the flu shot doesn't work as well on people who don't have adequate sleep.
Yeah, absolutely. So, basically if you get a vaccine of some sort, it's injecting some aspect of this virus or bacteria into basically exposing your immune system to this element that you're then asking the immune system to respond to and make an immune response or antibodies, either a B cell response with antibodies or a T cell response, which is then, that will generate some degree of memory. And that's why a lot of vaccines require multiple priming points, because you get sort of a certain percent, maybe 50, 60% response with the first shot. You bump that up to 80, 90 with the second one. You bump it up to 99 plus, whatever it is with the third shot, et cetera. But you're asking the immune system to kick in. It's not just like, oh, here's your shot and you're good, right? And so if there are factors which we've talked about, which are negatively affecting your immune system or stressing your immune system, that will, impair your ability to mount that response to the vaccine. And as a side note, asking your body to make an immune response from a shot is not a really natural thing for your body to do, right?
It's a stressor.
It's a stressor, but more nuanced than that. It requires a little bit of like a kick in the pants. So when they give you these shots, they frequently add what's called an adjuvant, which is like this thing that like just kind of pisses off the immune system. So it like generates this more of an immune response.
To try to have a memory.
So that you generate that immune response to the shot. But we do know that, people who aren't sleeping well or people who are under significant stress, that they'll have a blunted immune response. And it's the same thing as we age, right? So elderly people have less of an immune response to vaccines, right?
Yeah.
And so when we, when we were preparing our patients, who tend to be more sensitive and more chronically ill, not as a rule, but frequently, to get vaccines of any type, but especially as we went through the pandemic, we had them dial in as much of their lifestyle ahead of time, 2 or 3 weeks before. Make sure you're sleeping, make sure you're eating super clean, make sure you're hydrating, make sure you're taking a key group of supplements, antioxidants, vitamin C, magnesium, all the things you would think of, right?
Which the crazy thing is, if you were doing all those things anyway, this is not the focus of today's podcast, but kind of like if you were doing all those things anyway, you really don't even need the flu vaccine, right? I'm not here to give medical advice, and you're not here to give medical advice either. And vaccines is such an individual, conversation that people have. But the flu vaccine in particular is kind of like, to me, you don't have to respond to this because I'm not trying to put you on the spot, but I'm just saying it for the record. I kind of see it as like a little bit of a joke, right? Like if you're willing to sleep well, eat healthy, other stuff. And even then still, I think the statistics are, it only works like 50% of the time, right? Because they're trying to guess in advance what it is. And so, that's not to throw all vaccines under the bus, but if we can sleep more, if we can have a good diet, other stuff, we're not going to be as reliant on things like the flu vaccine. And
independent of whether we're talking about vaccines or not, hands down, no matter what, completely not controversial, you are going to do better from an immune point of view if you dial in all those things.
Get sleep, avoid ultra-processed foods, move.
Avoid
those
pollution.
Are the basics. Have community.
Yeah.
Those are the things that make a difference.
Mindfulness, gratitude.
Totally.
Amazing.
But we come back to the basics, which is really sleep. Sleep is a core basic. All right, let's go. We're going down a list of things of when we don't have them, when we don't have proper sleep, our likelihood of these things. We already talked about Alzheimer's. We talked about cognitive decline. We talked about cancer. We talked about weakening of the immune system. There's also, we've done many episodes on this podcast about the importance of maintaining a more balanced blood sugar, an optimized fasting insulin. So tell us what we know about blood sugar and sleep.
Yeah. So, and this is one of the areas where the research really shines. Like it's very, very clear that if you don't sleep enough or you get poor sleep, that you will disrupt your metabolic pathways through a variety of different mechanisms. There was one study, just to drive this home, where participants were recruited. They had no pre-existing issues regulating their blood sugar, and they were forced to sleep 4 hours a night for 6 nights. And after that time period, less than 1 week, they had such poor blood sugar regulation that they would have fallen into the pre-diabetic glucose range, right? And so this is happening through a variety of pathways. One of it is inflammatory, so more inflammation, decreased metabolic signaling and balance, but also specifically through these hormones. One's called ghrelin, which regulates our hunger and our cravings. Another one called leptin, which regulates our satiety or our, hey, I'm full signal, right? And studies have shown that individuals who are sleep deprived, don't get those signals properly, and they have more cravings, and their body can't listen as well to the signal of I'm full. They end up consuming up to 300 calories per day more. And there was a crossover study a separate study where the participants first slept 8.5 hours, and then they slept 4.5 hours. And they basically experienced far greater subjective hunger following the sleep deprivation, despite having received the exact same amount of food and exercise. So they controlled for food and exercise. And then they tested the hormone ghrelin, and leptin, and showed that they had significantly more ghrelin. So that's like the I'm hungry, go get food cravings hormone, and significantly less leptin, which is the I'm full hormone. Right. So very specific, information showing these set points, which are pretty dialed in a lot of people. Again, they'll go off balance if we push them too hard. Right. But sleep is one of those factors which can really push those metabolic.
I've even seen this in myself. I wear a CGM. I'm an investor in the company Levels. I love their app and their system, so I use their CGM. And there are periods of time where my sleep is thrown off, maybe because we're traveling and I have jet lag, or, could be, it happens very rarely now, but there are still times. There's been times where my wife and I are helping out. We don't have kids yet, but we help out with her sister's kids, or we help out with my sister's kids. And you just don't sleep as much, when you're in that situation, you're babysitting and things like that. And I've seen my CGM the next day, and my glucose is already starting off in the morning, where I'll typically be around 80 is, my readings that are typically in the morning. And normally when you get up in the morning, you have a little bit of a cortisol spike. And so your glucose goes up a little bit, and then it kind of comes down and you get settled. But I'll wake up in the morning sometimes and my glucose is already 95,
Wow. So it's a big jump.
It's a big jump.
Yeah.
Right. So it's have you ever seen that? I know you use CGMs and stuff.
Yes, absolutely.
Yeah. So even for people that consider themselves pretty healthy, pretty much immediately your body can have a strong response to not having sleep. Now, the counter to that is that generally, if you're avoiding ultra processed foods, if you get back on track, if you're not drinking alcohol or you're minimizing your alcohol greatly, if you have some form of movement in your life, we are designed to be resilient. We can handle these moments and situations. It's not that we're so fragile that 1, 2, 3, even 6 months of not sleeping well, sure, it'll take its damage. That's there, but plenty of people don't sleep that well when they first have kids. So it's not freak out. It's that, no, your body is resilient, and just when you can, do your best to get back on track. And it's not all or nothing. Even when you have disruptive sleep, and this is part of what we're going to go through in the solutions, we have a whole list of solutions that you've put together that we're going to cover in a little bit. There's so many things that you can do with what little sleep you have to try to optimize it and make it better. Yeah. If there is a period of your life where you're not sleeping as well. So I think that's an important reminder.
Yeah, no, I love that point. And it flips the other way too, right? So if you have somebody who, for a variety of other health reasons, they're tipping towards metabolic syndrome or pre-diabetes, or even, diabetes, or other cardiovascular metabolic issues, that is one of the levers that we want to pull in order to help to back that off, to try to reverse it, right? And or to minimize the negative effect of that condition, is dialing in your sleep, right? Because of all those exact factors, right? So
it's so true. I think the thing that we talked about, these long-term things, which are super important, cancer, Alzheimer's, but even in the short term, if you're trying to understand how to dial in your diet and feelings of hunger, just know you don't sleep well, you're going to be more hungry the next day. You're going to want to overeat. And in particular, it seems that people crave carbs.
Yeah.
Right?
No, absolutely.
That seems to be something that they crave when they don't sleep well. I know that's the case for me, for sure.
And then you're in a vicious cycle, right? Because, you crave those carbs, they cause blood sugar excursions, imbalances, the insulin's chasing it. You're on this roller coaster. When you eat carbs, they maybe make you tired for a variety of reasons, right?
Including if you're eating a lot of carbs.
If you're eating a lot of carbs.
Yes, you're not a carb if you're eating phobia or anything like that.
Right. And thank you. And to differentiate also between healthy carbs and unhealthy carbs, right? If you're eating a lot of white sugar or, pasta or crackers or chips or cake or cookies,
too much white flour, too much refined flour,
without a balance of healthy fat, healthy protein, et cetera.
Yeah.
You go on these excursions, you're on this hormonal roller coaster, which is also inflammatory and which actually also generates this compound called adenosine, which creates our sleep drive, and that makes you more sleepy. And so then you're kind of on this, now you're chasing that. You have the dip and you're trying to chase it now with more sugar. And so, yeah, a lot of folks get on that roller coaster, and they when they flip that around, they realize, okay, if I really dial this in and I keep my blood sugar as steady as possible, those cravings go away, my sleep improves, my energy improves, my brain function improves. And so just a really nice feedback loop there.
On the other side of things, in a good way, that I just want to share is that since my sleep was always pretty good, my sleep was good. It was the movement piece that I had not developed a regular strength training practice. And I'm working with the group over here in Brentwood called Ultimate Performance. And I've really dialed in my, 150 minutes a week, right? For me, it's
awesome.
Going three times a week. Which also working out has, can improve your sleep quality too.
Oh, absolutely.
We could chat about that.
Yeah.
So when I work out and I get my strength training in, excuse me, and on top of that, I'm sleeping well, my blood sugar baseline is lower, and I can get away with eating more carbohydrates.
Yeah. Because you need it, because you're using it.
Because I'm using it.
Yeah.
And it doesn't have an impact, not just on my blood sugar, but also, I measure my fasting insulin pretty regularly, like every other month through my blood work and stuff. And my fasting insulin stays in sort of the optimal range. I just measured it recently. It was 3, even though I'm probably eating now twice as many carbohydrates than I was previously. And that's just another reminder that you can get away with, again, not carbs are bad, but you can get away with more leniency on your diet when your sleep and your movement is more dialed in.
Absolutely. And there's a variety of interesting mechanisms on that too. One that I want to point out for your audience is, blood sugar balance, right? So we eat carbs, we eat simple sugars, or carbs are broken down into sugar in our body. We have, sugar that's in our blood now. In order to tell that sugar to go into the cells, you use a hormone called insulin, which is released from the pancreas. And when that axis gets bent or broken, then you're on the road to metabolic syndrome or even type 2 diabetes. Completely separate from the insulin signal, which is sort of the key that opens up the cellular lock to let the sugar in. Totally separate from that, completely non-dependent on insulin, is a glucose transporter called the GLUT4 transporter, which if you're working out and lifting weights, is expressed more in your muscles and will just basically suck up sugar because it needs it. It needs to build those muscles.
Muscle uses glucose.
Right, uses glucose, and it has a non-insulin dependent transporter. So it's weight training is so many amazing benefits, but super important factor for metabolic health.
Yeah. A friend of ours who's been on the podcast before, I don't know if you guys know each other, Dr. Gabrielle Lyon.
I don't.
She says muscle is really the organ of longevity.
Yeah.
Right. We went through this phase in the world of sort of eating. I definitely was there too, where we kind of deprioritized protein. Right? We thought protein's not that great. Even a lot of longevity researchers were talking about you don't want too much protein, mTOR, this, that inside the diet, and definitely in the plant-based community. But I feel like people are starting to shift and realize that protein is so essential for building muscle, regardless of how people want to, get it. They can get it through vegetarian, which is a little bit trickier and tougher. I was vegetarian for a long time. I know firsthand.
Yeah, I was too.
And yeah, we could chat about that. Or you can get it from, inclusion of targeted clean animal protein inside your diet.
I agree.
And building and maintaining muscle mass is so important as we age for all sorts of things, but especially as you mentioned, blood sugar and insulin. I want to pivot here for a second, and I want to, we're going to get into cardiovascular disease next, but before we do, and we'll also talk about psychiatric and mental health, I want to take a pause here for a second. Generally, I think most people know that, if they have a night of sleep that is thrown off, right? I didn't sleep that well. And in fact, I saw Dr. Andrew Huberman tweet this one time. He said, instead of next time you catch up with somebody, don't ask them how you're doing or what's new, right? If you really want to create connection with somebody, ask them, how'd you sleep last night?
Yeah.
Right. Everybody's got a story about that, right?
Yeah.
It'll open up more of a dialogue. You'll learn a lot more interesting things about them. So shout out to Andrew, who's been on the podcast before. But one thing that people are not good at, it's that whole frog and boiling water thing, which I don't know if it's true or not, but we get used to our environment. So a lot of people don't know over the long term if this disruptive sleep that they have is either normal or if there's actually something wrong. So how do you know if you're sleeping well? When you sit with patients at the California Center for Functional Medicine and you're talking to them or you're having them fill out questionnaires, what are some of the questions that you're asking them to know? Is their sleep good or is it off in some ways?
Yeah, that's a great point. And there's so many reasons that we could unpack that for a while of why people lose touch with their internal state and then how they're feeling, right? You know, many folks with chronic illnesses are just sort of in this soup of unpredictability and things are, there's a lot of moving parts. They don't always quite know what to expect. And then, you know, we also have a lot of coping mechanisms and compensations that are, you know, psychological or physical that are hard to unpack or unwind. But the basic, you know, things that I like to know from somebody is, you know, first of all, how do you feel? How do you feel? And my wife teases me because I'm a huge wearable geek and I love the data. And I use Oura Ring and I'm just always playing with some other wearable, you know, usually wearing more than one and comparing. She's like, I don't need a wearable. I don't need the data. I know how I feel, right? How do you feel when you wake up in the morning? Do you feel rested? Do you feel ready to go, right? But
which may be right for her.
Right.
I saw this tweet. Tessa, see if you can find this tweet. It's Mark Sisson. He's the founder of Primal Kitchen and considered like the grandfather of paleo. It's something I'm going to paraphrase here. We'll see if we can find it. If I ever need a device to tell me how I slept last night, please shoot me. Yeah. Right. But there's other people on the other side that they don't have strong interoception, or maybe their sleep was thrown off previously. As you mentioned, you were working at night sometimes. And there's other people who just genuinely enjoy the data because they're always looking. That's kind of me. I love to test my Whoop with my Oura Ring and try this because I'm always looking at what can I learn from different ones. And then people ask me all the time, which one should I use? Yeah. So this one's better for this and this one's better for that. Right. Agree. But it's funny what your wife said, because I think that a lot of people feel that way too, which is great. If she sleeps well and feels good and doesn't need devices to tell her how she's doing, like, more power to her.
And the flip side for me is, like, I know there are mornings when I don't feel rested. And as a side, we can get into that, but I'll frequently, you know, target a midday power nap for 10 or 15 minutes only and probably don't even fall asleep, but just that rest and reset is like I had a cup of coffee. But for me, I know there are nights when I haven't slept well and I'm going to sort of get through my day, but having the data longitudinally helps me make decisions around what I'm doing, when I'm doing it, how I'm doing it, and isolate factors that are really key for my own health and my own sleep. And you can see the data change over time. And so what for me, just as a short rundown, the things that are really important are morning light with some gentle movement for 10 or 15 minutes. And then, the evening wind down, right? Not having a meal after 6 or 7, not having screen exposure, doing some wind down, not drinking too much fluids late in the evening. All those factors are really key for me. Doing some breathing, gratitude practice right before bed. I do that every night. So, but what I tell my patients is like, okay, I want you to get this device. If you want to look at the app every morning and look at the data, that's fine. Go for it. I don't need you to. What I'm more interested in is like, what does that data look like in a month? What does that data look like in 6 months, right? And can we go back now and say, okay, we're doing this now. What parameters have changed compared to the past, and what's working, what's not working?
So you want to know more about what are their averages over the course of a month,
trends,
right?
Yeah,
trends. And then when we dial back on alcohol, or when we eat earlier, or when we get morning light, and we're doing some of these habits. Now let's look at the next month and see, how are you doing? So you're kind of looking at their baseline and then you're comparing that. Do you have a favorite one of the apps or trackers that you like to recommend for people that you find is easiest to use?
I like the Oura Ring a lot. The form factor is great. It's small, it's light, you forget about it. And the fact, more importantly for me, the fact that it's on your finger, we get a signal directly from the digital artery, which is a much louder signal for the sensors to pick up. And so you get a higher fidelity reading on the heart rate and on the heart rate variability. And the heart rate variability is the metric which I care the most about, HRV, really amazing marker for a variety of different indications on your balance of your sympathetic and parasympathetic nervous system. And the wrist-mounted devices are good, but again, you're picking that up from a capillary signal, which is sometimes a little bit not as loud and a little bit noisier. The breakdown of all these devices, in my opinion, is when they try to move from here's your raw data to here's your score, here's your sleep score, here's your readiness score, and because those are now based on an algorithm that's proprietary to that company, and my own internal experience of that is it doesn't always match, right? And so I feel much clearer about the raw data and what that says about how I'm doing and how I'm feeling. But they're getting better, right? So I think we're in the early phases of this whole journey right now, and I'm very confident that the data is going to really prove out, and many of the currently available commercial devices have improved pretty dramatically over the last few years.
Yeah.
But one thing that's fascinating for me also, when we did our cohort programs, whether with patients or with firefighters and police, we had them all wearing wearables, and the same thing. If you want to look at it, great. If you don't. But we're going to pull that data and we're going to look at that data, and we could show this really incredible response to simply getting them moving and cleaning up their diet, putting them on a 30-day whole foods, anti-inflammatory nutritional reset. We saw a dramatic increase of heart rate variability. So increased HRV is good. It's a sign of relaxation nervous system kicking in, less stress, less allostatic load. And over the course of that program, we were able to demonstrate as a cohort a drop of 8 beats per minute of the resting heart rate, increase of HRV by 22%, and then increased markers of sleep. So 36% improved deep sleep, 35% less time it took them to fall asleep, so improvement in sleep latency, et cetera. So that's where I love the data, right? That's where I think the data really shines. And I think that I'm generally just very excited and passionate about the data. I think that there's so much that we're doing in functional medicine and in these functional medicine clinics, and we're all working on trying to solve this really, really thorny problem of chronic illness, which is going to bankrupt the health system if we don't do better, right? The allopathic conventional medical system is simply not set up to handle that. Allopathic system is awesome when it comes to urgent situation, a surgery, you need the ER, your cardiac event, et cetera. Amazing work. But the chronic illness side is where it falls apart.
Totally.
And, if we can pull in data and sort of build now a data dashboard, which is kind of acting like one of our ultra-modern cars, right? Where there's all these sensors figuring out what's happening as an internal milieu, and that's labs, and that's, patient-reported symptoms or patient-reported outcome measures, PROMs, and that's wearable data. And I think it can even go bigger than that, and it will go bigger than that. It can go to social use, and having gauges of how much are people moving around, like just following the GPS and seeing like, okay, lots of excursions versus someone who's bedbound is moving very little at all. And how does that change with different treatments, and starting to generate visibility and insight into what is working, what's not working. So it goes deep. There's a lot of,
it goes deep, but it brings up this, this important point that I think a lot of our listeners are going to resonate with, is that, and then, we'll jump into cardiovascular and mental health and psychiatric. Tessa, there's this article that I wrote on my website. I Try This newsletter. It was called three Crazy Facts About Big Pharma. John Abramson wrote a book called The Sickening. And inside of that book, he takes on really the pharmaceutical industry, specifically around SSRIs, medications, like just the corruption that's in pharmaceutical. Yeah. He's a Harvard guest lecturer and professor at Harvard Medical School. And you might have to search for it. It's John Abramson, Crazy Facts About Pharma, Big Pharma. You could type in that as well. And if you don't find it, Tessa, no worries. I'll try to do my best. So much, you turn on the news, you turn on daytime TV. There's this running joke that it's all sponsored by Big Pharma, right? It's not a joke. It's true. But you'll see these memes online, like brought to you by Pfizer, brought to you by Pfizer. Drugs are so pervasive in our culture. And obviously drugs have allowed a lot of really great things that happen. I'm sure you have family members that are on different pharmaceutical drugs, but it's when these pharmaceutical drugs are nefariously promoted as the right solution when they're not addressed as compared to what.
Yeah.
Right. So one of the big, I'll see if you scroll down a little bit here. I'll try to read it. Okay, so I'm just going to read this real quick because this is like an area that I'm very passionate about. And this is an excerpt from his book. Okay, so one of the questions that's being left out of the conversation when it comes to pharmaceutical research is, how does this drug intervention compare to lifestyle recommendations? Because the FDA doesn't require drug companies to explore this question, many doctors walk away with the notion that a drug intervention is often the best option, and that soft interventions, by the way, people think of sleep as a soft intervention, like eating healthy, sleep, exercise don't work. Many doctors also develop the false belief that patients have zero interest in doing the hard work, because again, we don't have studies on it, and are only interested in quick fixes. So here's an excerpt from Dr. Jay Abramson's book, who's been on this podcast. We'll link to it in the show notes. So it says, the definitive study showing how best to reduce the incidence of diabetes was done in the 1990s. The Diabetes Prevention Program Research Group, publicly rather than commercially funded, randomly assigned more than 3,000 people at high risk of developing diabetes to one of three groups: standard lifestyle recommendations plus placebo, standard lifestyle recommendations plus metformin, which, if you guys don't know about that, it's a blood sugar lowering medication, or an intensive counseling about healthy diet, exercise, and behavior modifications plus placebo. The primary outcome was the difference in the percentage of people who developed diabetes in each group after 3 years. So here's what ended up happening. And this is what they found from this study. And again, remember, this is the definitive study on this topic. The studies was highly unusual that its goal was to determine the best way to decrease the risk of diabetes, instead of just trying to prove the efficacy of a particular drug. Fast forward, the results were stunning. First, they resoundingly debunked the conventional wisdom that people won't change their habits and that physicians' efforts to get them to do so are a waste of time. At the end of 3 years, people assigned to the intensive lifestyle modification group lost an average of 12 pounds and significantly increased their physical exercise compared to the other two groups. And to conclude, and second, the study showed by far the best way to prevent diabetes is through positive lifestyle changes. So why I thought about this is that, you're talking about the data. And I think that one of the things that everybody's excited about in the future is if we can somehow organize these independent sort of clinical trials that people can opt into using their wearables, we can start to see the lifestyle modification components that people are doing. And we could see that if we had a national emergency around sleep, or like, let's say, processed foods, could these things work better than the best known drugs that are out there and available to us? And then we would have the data. And now well-meaning and well-intentioned practitioners and doctors that are out there are like, no, actually, let me put in, and the insurance companies would get behind it. Let's put in that extra bit of effort because this works far better than anything else. I just thought that excerpt from the book, which is really talking about a lot of the corruption that's inside of big pharma, and there's a lot of good things too, just was a reminder of what's possible when we lean into these soft, these things that are considered soft, but actually have a profound impact on our health.
Yeah, that's so important. I love that article and that book. It's there's a lot of hurdles in the medical system to that, and for doctors, it's time, and it's also the money incentive from big pharma. Right. They're pushed to prescribe the drugs, and these big pharma companies are spending just untold billions of dollars developing these drugs, and so their job then is to recoup the money for their shareholders, et cetera. So they're not incentivized or even able to, from the pharma side or from the doctor side to really do those intensive counseling, intensive behavioral modifications. And, but that's totally fixable, right? It's not a complicated problem to solve. And the doctor should not be the one who's doing that work, right? Because they are too busy and they're doing these other extremely important roles. I think in general, most, if not, the vast majority of medical professionals are very wonderful, caring, supportive people who are in a career of service, right? but they are also stressed and crunched and don't have the time, and they're in this sort of mill of moving people through, right? So what needs to happen is to have support around that. And that's one thing that we have done a really careful job about building at our clinic.
Yeah, you guys do a good job about that.
We try. We really work on it.
Can you explain it a little bit for those that are listening? And if they want to like work with your clinic, they can kind of get a preview of how you guys work.
Sure. Yeah. So we mentioned the technology side. So think of that as like the high tech side. But then the counterbalance to that is what we call the high touch side, right? And, I really firmly believe that everybody should be working at the top of their license and of their ability. And so then what we have is a care team, and we have a really amazing team of people who I get the pleasure of working with every day. We have physicians, we have nurse practitioners, we have PAs, we have health coaches, we have nutritionists, and we have a really amazing admin team. And so the person, when they come to work with us, has multiple touch points along the way, right? And so they do a deep dive intake. They start to do their comprehensive lab testing that we order. They immediately go to work with the nutritionist. After they've done that, they've sort of been downloaded. Okay, here's what we want you to do in terms of testing and in terms of nutrition interventions. Then they go to see the coach, because now they're probably feeling a little bit overwhelmed, and we've given them a lot of to-do items, and it's somewhat complicated. And so they go and work with our coach and help to put the plan into place. And then when all that data comes back, they come back to the clinician and get that interpretation and next steps of the plan, right? And so that's one aspect of it, of this high touch point of view. I think there's also a lot of opportunity to really dig into questions around learning theory and the science of health behavior change, and what does it actually take to be successful at that, because it's not easy, right? We all hit the ground running at the start gate, whether it's New Year's or it's engaging with a new clinician, or it's, reading an awesome book that gives us some inspiration, or, one of your podcasts, or it's, all these opportunities to get this information. But then putting that into place and then following through and sticking with it is where things get harder, right? And so we know a lot about habit change and how to be successful at that. And I really believe that there's this role here for both that high touch side as well as this high tech side to really make an incredible difference in the, how we're taking care of folks with chronic illness and helping them get their lives back.
Yeah, well said. All right, well, we teased about it. Let's get back to it. Sleep and our increased risk of all sorts of things. We talked about a bunch. Let's go to cardiovascular disease next. Everybody wants to protect their heart. Everybody wants to be heart attack proof, or try to step into that as best as they can. What have we found out when it comes to cardiovascular disease and sleep?
Yeah, so there's a lot of data out there. I'll touch on a few. We've shown, studies have shown that adults over 45 who sleep less than 6 hours per night are 200% more likely to suffer a heart attack or a stroke than those who are sleeping 7 or 8 hours per night.
Yeah, it's wild. When I think about that, some of the stuff that comes up for me is that I've generally been someone who tends to be more like the 6 to 7 hours. Mm-hmm. But even at 6 hours, I often find that my body, especially as I've gotten older, and I've been working on this, I recently got a metabolite test done. Mm-hmm. to make sure that my gut is working optimally. And one of the metabolites that's related to serotonin, again, I don't know the whole science around it, was low in my sort of reading. Mm-hmm. This was a blood test that I did. And I was mentioning to the group that was kind of walking me through it, I was mentioning I've been having this thing for the last probably 4 or 5 years where I wake up at 3 a.m., pretty much all the time, without an alarm clock. I wake up, it's 3 a.m. I end up having to go use the bathroom, pee, whatever. And then I go back to bed, and it takes me about 30 minutes or so, and then I kind of fall asleep. Mm-hmm. Right. I feel rested. My energy is good. I don't feel like I need I don't take naps or things like that unless I'm really tired. Is that anything that I should be, doctor, is that anything I should be worried about?
Yes. A couple of questions that come up. What time what's your last food that you eat in the evening?
I generally finish my dinner before 7:30.
Okay.
Yeah.
And then what time do you lay down for bed?
I get into bed pretty early, even before the pandemic. Most nights, I'm in bed probably by 9, and I fall asleep by 9:30.
Mm-hmm. Nice.
Yeah. So I'm there. So I guess, let's say I'm asleep by 10.
Yeah. That's
right?
great.
So
And then
10 to
how much
11.
fluid do you drink before in that after dinner or around dinner towards bedtime?
Yeah, I try to minimize it, but I naturally end up having like a little bit of like for my final supplements or so. Like I try to keep the last hour fluid free. But like 2 hours beforehand, I'm taking my magnesium, I'm taking my 5-HTP, I'm taking, different things that are there. I know the goal is to try to minimize fluid. That's one of the recommendations, so you don't have to get up and pee.
Right.
But I find that, I have to kind of take some of those things. Maybe I should bump them up a little earlier. But yeah. I take them about like 2 hours before bed. I drink probably like a half glass of water to take all my supplements.
Okay. And hopefully last question. And
yes.
I'll let you off
please,
the hot
please.
seat. How much caffeine do you drink and when?
So I have a iced coffee here. I generally only have 1 cup of coffee. Usually it's like a espresso at home, which I know has a little bit less caffeine. This is iced coffee, so it has a little bit more caffeine. And I'm done. I'll probably nurse that right up until 12 noon, right? But it's just one glass, right? Yeah. 1 cup.
Yeah.
Sometimes I don't even finish it. Like this is the coffee that I've had today. I won't even probably finish it since it's like 11:30 right now as we're recording. Yeah. But noon is like my caffeine curfew.
Yeah. Okay. Yeah. So there's definitely some discussion out there so insomnia, right? Difficulty falling asleep, difficulty staying asleep, but there's different flavors, right? There's sleep onset insomnia, which is difficulty falling asleep, and then there's sleep maintenance insomnia, and people can wake up at any time during the night. But, 1 to 3 a.m. is a very common time. 4 to 5 a.m. is another one. And then waking up too early and not being able to fall back asleep. So that's called terminal insomnia is another one. The 1 to 3 a.m., is kind of where I start to think about the half-life of caffeine as one question. So I'm sure you know this, but caffeine has a half-life in most people's bodies of about 8 hours.
Right.
And so if you drink 1 cup of coffee in the morning, by the time you're going to bed, you still have about a quarter cup of coffee in your system, right? Now that caffeine is, basically we talked briefly about this compound called adenosine, which is basically sleep pressure. It causes our sleep pressure and it builds up over the course of a day. And so you're starting to feel tired. You're feeling sleepy. You're feeling groggy. You want to go to bed. That's what helps us go to sleep. It's part of our circadian rhythm, right? So the adenosine is binding to these receptors and is telling your body you're sleepy, right? Now you go to sleep and you have this adenosine dissociation curve. And so the adenosine starts to pop off the receptors because it's like, cool, you're not sleepy anymore. But if you still have caffeine around, caffeine's like, ooh, look at that receptor. And it's going to jump on the receptor and it's going to wake you up, right? And that's going to be compounded if you've had some fluid because now your bladder is going to be telling you, hey, you have to go pee. You might want to wake up, right? So it's kind of whispering in your ear. But also other things that we think about are thyroid. So sometimes we see that 1 to 3 a.m. awakening with low thyroid function, either subclinical or clinical, but also liver, right? So 3 a.m. is a kind of a classic, traditional Chinese medicine liver meridian time. And so sometimes when I see that, I'll have people, again, careful about the caffeine, careful about the fluids, dial your evening routine. But maybe take some milk thistle in the evening, and I'll do a relatively high dose, like up to 1,100 or 1,200 milligrams of milk thistle in the evening time. That's also a big reason why it's healthier for your body to not eat late, number one, but also not eat a huge meal when you have dinner, which is really hard for me personally because I always grew up with the family dinner. I was lucky in that way, but dinner is always my biggest meal, right? But the old adage is that you should have breakfast like a king or a queen, lunch like a prince or a princess, and dinner like a pauper, because your liver function is actually dramatically decreasing after about 3 to 4 p.m. in the afternoon. So just some things to think about there.
Totally.
It could also be, something that's kind of jacking up your norepinephrine, so one of your stress hormones, right? And that goes down a whole other, pathway of, what's stressing your body, what's causing inflammation, are there gut infections, et cetera.
Yeah. And temperature is another big one.
Temperature is a huge one.
We'll get to that in a minute.
Temperature's a cool
that's
one
on your list of items.
Yeah.
Okay, cool. We still have a couple more things that I want to touch on here that you've really highlighted. Again, when we don't have sleep, our risk of these things increases. People don't think about this often, but psychiatric illnesses, depression, anxiety, bipolar disorder, and even suicidality, right? Talk to us about that. You mentioned that with also the first responders. So tell us how our risk of depression, anxiety, all these mental health disorders increase when sleep is not dialed in.
Yeah. So big picture view, Sleep, not having enough sleep, having inadequate sleep contributes to nearly every major psychiatric illness: depression, anxiety, bipolar disorder, suicidality, schizophrenia, etc. And there's a lot of data on this. There was a research team in Italy that was working with bipolar patients. And after just one night of inducing sleep deprivation, a large portion of these subjects spiraled either into a manic episode or a depressive episode. And I think, what we know is that part of what's happening is that, there's a lot of communication and signaling that's happening in the brain. The prefrontal cortex, which is responsible for rational thought, for logical decision-making, is normally coupled to the amygdala. And the amygdala is our reptilian ancient brain, which basically has three choices: fight, flight, freeze, right? It's our sympathetic nervous system, signaling for emergencies. So that coupling is usually nicely in place, but we see that when there's sleep deprivation, that balance is broken down, right? And so in sleep-deprived individuals, there's about a 60% increase, some studies have shown, of amygdala activation compared to individuals given a full night's sleep. And this pretty strong coupling between these two countering brain centers is weakened. And you can also see a lot of emotional lability, right? And I think this is part, not just being tired, but like you're crabby, you're grumpy, you're like, I can't quite deal with anything more on my plate right now, right?
Basically, you don't sleep, you kind of become an asshole to the people around you, including the people that you love.
Absolutely. And you don't feel good. You just feel like blah, like this is not a good day. Like I can't wait to try to get back in bed and do over, right? But there's a researcher over at UC Berkeley, Dr. Alison Harvey, who's done a lot of work with cognitive behavioral therapy for insomnia, CBTI, which is really important for people to know about, CBTI, in the treatment of a lot of different psychiatric conditions. So just getting these people to sleep better by improving their sleep quantity, by improving their sleep quality, their sleep regularity. Dr. Harvey's protocols have really shown a lot of improvement in symptoms of people with depression, with bipolar, with anxiety, even suicidal ideation, right? So really, really profound. It's the same goes with substance abuse.
And before you get to substance abuse, are you aware at all of the literature around hypnosis and improving sleep? There's a gentleman that we had on the podcast. I'm blanking on his name, but maybe Tessa, you could find it. The website's called Reverie is the name of the app that he built. And it's free for, I have no association, but it's free for people to try for I think 2 weeks if they want to do it.
Yeah.
And click on, if you can see the About team, maybe in the footer. But you can see those, for those that are watching the video version of this, it's Reverie, Reveri. And one of the gentlemen is you were talking about Alison Harvey up at UC Berkeley. This gentleman is at Stanford. And the name will come back to us, and Tessa, no worries if you can't find it. But he has done a whole group of studies around reducing anxiety using hypnotherapy in this app that he's built, as well as getting us to kind of quiet our mind, which is one of the list of things that you said that people have David Spiegel. That's the gentleman here. David Spiegel is co-founder of Reverie and chief scientific officer.
I love David Spiegel's work.
Yeah, he's really great, and he's done a lot of stuff on hypnosis. But yeah, just made me think that, there are tools that are out there. Like you were talking about
Absolutely.
Cognitive behavioral therapy, right?
Yeah.
Hypnosis, which sounds crazy, but it works for people that can help individuals get to bed quicker, quiet the mind, and even potentially stay asleep longer.
Absolutely. Yeah. No, I have not seen Reverie, but that looks amazing. There's another app that we've worked with called Breathe. With 2 E's.
Like a breath work app?
But it also captures, it does do some breathing and mindfulness, but it also captures some hypnosis and aspects, and also some aspects of CBTI, cognitive behavioral therapy for insomnia. And so absolutely, it's really about accessing, again, these different levers that we can pull that can have a beneficial effect. And, you absolutely can reprogram those aspects of your brain, and you can retrain those neural networks, right? It's all about neuroplasticity. The brain is happy to learn and grow and change some of the wiring that's there if we give it the right information and the right practice and the right repetition, right? So I'm a huge fan of neuroplasticity in general. However, when we, the thing that I really like to think about is that and Matthew Walker in his book Why We Sleep said this. So I love it. I'm just going to make
Please.
sure that we all know is from him. But he said, getting ourselves to sleep is like landing a plane. Right. So if you're on a flight and you're flying from Los Angeles to New York and you have the flight and then you get, towards your destination, there's a whole series of different checkpoints that happen well in advance of, the actual hitting the ground that are necessary and, happen in a very, very important sequence to get that plane safely on the ground and effectively on the ground. Right. So sleep is the same thing. And we need to have a system. We need to have a plan, and we need to have some support and habits and different checkpoints in terms of time and behaviors that we can implement that will much more effectively get us asleep. And it's really like, if you think about it that way, it makes total sense. And it's really not a surprise that a lot of people are having trouble sleeping when we work hard, we maybe exercise, hopefully, maybe not. We don't eat great food. We're feeding that, intense information into our body. We get home, we maybe late, 5 or 6, 7. We try to eat a quick bite. Maybe we have some alcohol, maybe not. And then we're watching TV or on our laptop, or checking some more emails, or we're doing some social because that's our wind down and the way we relax. And and we have our lights on in our house and they're super bright. And, there's all these factors that we're just completely neglecting hey, I'm going to try to land this plane into bed and go to sleep. And then boom, we had, last minute, we shut off our screen, we brush our teeth and, hit the pillow, but pick up the phone because I want to set the alarm. And then maybe you spend another 15 or 20 minutes on TikTok or Instagram, scrolling your amazing posts. And, so, we're all consuming all this information and content.
It's like trying to land the plane by crashing.
Right.
Right.
So then you lay down in bed and your mind is just racing, right? Your mind's just going, and you've done nothing to start that process of slowing it down. Right.
Which naturally happened in our environment hundreds or thousands of years ago. Absolutely. Before the advent of electricity. Yeah. But now we have to sort of fight for it. Yeah. Right. We're fighting for it. I was laughing when you were talking about your lights, because I was recently at a friend's place for dinner, and I was sure I ate at restaurants and other things like that. And I'm like expecting that it's going to be a little brighter and stuff, but I hadn't been over to a friend's place for dinner in like a little while. Right. It's been a few months. And, when I got there and our dinner was a little late, the lights were so bright compared to how I usually start to wind down the lights and close the lights down. It's not about, you don't need to have red lights everywhere, but if you do, great. But if you don't, just even dimming the lights, not having the overhead lights on really bright. Yeah. And their lights were not just so bright, but it was that white fluorescent type light. Yeah. And I remember going in, and I did not sleep well last night. Yeah. I really had a hard time falling asleep because we were out late and I was super overstimulated by, these lights. Yeah. And it just was another reminder of wow, I'm so glad that in my routine, I wind those lights down, which is a big part of your recommendations. Yeah.
I mean, So first of all, I'm sorry I didn't sleep well. I know how that can feel. And, but to your point of that's just one amazing aspect of how out of balance we are with our natural environment, right? So that landing the plane analogy, if you're, we're not living outside these days, but for example, when I go camping, I love camping, right? You go camping. I don't know if do you like going camping?
I love the idea of camping. I've just never been.
Really?
I'll take that back.
I'm going to take you camping. We'll have so much fun.
I've
awesome.
Camped in, I flew to Kenya for a group trip. That's where I was originally born. It was the first time I'd been back, and I've never camped in my life. And then I had the most epic camping experience. I was camping in the middle of this 1,000,000 square mile elephant,
oh my gosh, amazing.
Refuge. And they tell you for those that are open to it, we're going to set you up with a tent outside. And listen, the elephants are probably going to come and check it out because they're curious, but as long as you don't freak out, they're not going to do anything. And I remember sleeping. And then I heard this rustling outside, and I looked out my tent window, and I was in the tent by myself, and it was a massive elephant.
Beautiful.
That was just checking out the tent. And I was like, this is fucking crazy, but also how exciting and amazing. What a good reason to have your sleep interrupted. An elephant is outside. Great. And I went back to sleep. So I've not camped outside of that, I need to do more camping in my life. But
yes.
Please go back
so
to
one
your
of the
story.
things that's amazing about that is you just get a taste of what it was like and what it can be like, right? Where, darkness comes and you don't have light around you. Maybe you have a headlamp or, you brought a lantern to wash up the dishes, but pretty quickly then you all settle around the campfire and you're just sitting there kind of staring into the embers and the light's super low and maybe someone's playing the guitar and the music is nice. And, but your body's getting into alignment with the light day, the light dark cycle of the day. And you're not being exposed to these super bright lights, which, your eyes, so we can get into melatonin a little bit, but your eyes, they're sensing what's around you. They're sensing light, and that information is processed by the brain. And there's this part of the brain called the suprachiasmatic nucleus, which sits right above that crossing of those optic nerves, and is sensing the light from your environment. And then that suprachiasmatic nucleus, when things start to get dark, signals to the pineal gland to say, hey, make melatonin, right? The dark is coming. It's going to be time to go to sleep soon. And so you get this natural rise of melatonin, which, is a little bit misused in terms of a sleep aid. It's not really something that necessarily helps people stay asleep. It's more like the mark of the start sleeping. But you didn't get that mark last night of start sleeping. And so, right, because your melatonin was probably unnaturally suppressed, especially since it sounds like you do a really nice job of trying to optimize that during your normal life. So it was a difference, right? Your body was like, whoa, this is pretty different from what I'm used to seeing. And so you had that, activation and experience of having trouble falling asleep.
Absolutely. You had this diagram that you shared with me in the notes that you sent over, and you were walking us through like, what does like sleep look like?
Yeah.
Right. I think it's worth touching on for a second. You hinted at it a little bit, but just like walk us through like what is happening. Sleep is not one thing. It's kind of many different cycles that are all happening there. Can you give us a little bit of an overview of that?
Sure. Yeah, absolutely. So the current consensus is that there's about 4 different stages of sleep, and these are grouped into wakefulness, REM sleep, light sleep, and deep sleep. And in a normal night of sleep, we will cycle multiple times through these different phases, and the different phases will happen with different duration during different parts of the night. For example, it's common to go pretty quickly from wakefulness down into deep sleep and get a couple of cycles, longer cycles of deep sleep early in the night. And then later in the night, you tend to get a little bit more REM sleep. And so, basically, with a regular sleep cycle, we go through these multiple times. But if you're not getting to bed on time, you're not going to bed until midnight, 1, you're actually, even if you get 8 hours, you're going to lose out on some of that deep sleep. You're not going to get it. And so it kind of talks to the importance of getting not just enough sleep, but the right timing of sleep.
I also heard that, especially for those that are interested in, we talked about muscle mass, everything like that, but it's not just muscle mass. It's related to so many other things. Regular sleep time also plays a role in your body's production of growth hormone.
Yes, absolutely.
Right? And if you are constantly varying it, your body may not optimize the release of growth hormone, which happens within the first phase of sleep. I believe in the first hour that you sleep, your body's kind of releasing some of that growth hormone that's there.
It cycles. But in addition, cortisol, testosterone, estrogen, progesterone, DHEA, pregnenolone, all these are have a circadian cycle to them.
Got it. So first takeaway, if you are sleeping at different times, that right there is already one thing that everybody can do. Yeah. If you can, again, there's different situations that people are, not going to be able to do that. But if you have a huge variety of what time you sleep, setting sort of not just a sleep time, but actually I find that it's important to set a wind down time.
Yeah.
Right. There should be a time where it's like, okay, it's time to start winding down. No different than how we do with kids.
Yeah.
So I think it's important.
Yeah.
My wife for many years was investment banker, staying up in New York, 2 a.m., working, putting a deal together, etc. So her dialing into, and she's been very open about this and the impact that it's had, her dialing in and just setting a time of like, okay, I know I work a lot. I know I'm starting a new business. I know I have a podcast and I have this. This is the time that everything starts to wind down. In our house, it's usually around 8 o'clock that it's like, we're going to I'm going to pass her the blue light blockers.
Mm-hmm.
I'm going to start to dim the lights around around that time period. We're going to start to wind down on technology, TV, and just get ready for, as you mentioned, landing the plane.
Yeah, that's awesome.
Do you guys do that? Do you guys do anything in your house? Is there a time period? I know your kids are a little bit older.
Yep.
Is there a time that you set? And what time do you fall asleep?
Yeah, I usually will turn off the lights 10, 15 to 11, which to be honest is a little late for me. I do need about 8 hours of sleep to function optimally. And so my ideal wind down will look something like, no food after 7 o'clock. Again, try to not have any fluids after about 8. Try to be off screens, which honestly is a struggle. Be very transparent about that. I'm not always good at it, but I do really notice the difference when I can do it well and when I don't. Doing some stretching, putting some music on, some gentle exercise in the living room, doing some, floor work is awesome. I love that. But basically, getting in bed with a book, reading with a not a very bright light, so I'm not exposed to that. That's super helpful. And the nights when I do that are pretty, clearly better than the nights when I don't. And so it's again, it goes towards, that's why part of why I'm so interested in that health behavior change side of it. Like, what do we do to make this a more of a reliable thing that's possible for somebody to accomplish? So,
have you seen this hack? We'll link to it in the show notes. Most people have iPhones. So there's this hack, which again, you said yourself, and I'm not promoting screen time, but I'm also want to be honest with people.
Yeah.
Is that I often am looking at my phone as somebody who's a CEO, has a lot of people on my team. I'm kind of checking on stuff before I, close down. I'm not like on my laptop, but there's this hack where basically you can set your phone, people have blue light blocking glasses and that's great. But often at night, I wear them kind of gearing up to bed, and then we have a red light on in our room. And there's this hack where you basically can set your iPhone to do an automatic red light.
Oh, cool.
That you just so we'll link to that. It's a stupid little hack, but even having that, because there's night shift mode on the iPhone, but it doesn't get that red.
No.
This is like a total red filter. Yeah. So everything is blocked out there.
Yeah, super red. It's totally red screen, which is really cool.
If you can't see, you can't see it on the screen over here, but like everything is red on there, and it's a little hack. Actually, shout out to Max Lugavere, who was the one that showed me. We were out at dinner one time. He's like, "Oh, check this out. You can do this on your phone." But the reason I bring that up is that as much as I know that screen time is not helpful, I also have been very honest on this podcast that one of the ways that my wife and I wind down is I'll usually throughout the week, I'll find these like interesting sort of slow paced, like almost like documentary style, short things that are put together. Like Business Insider does a bunch of them. Sometimes it's like how something is made. Mm-hmm. There's also this guy that I follow on Facebook who makes these like very chill videos about what life is like in Japan. Mm-hmm. And it's a very relaxing thing. We find it very relaxing.
You're like traveling a little bit, getting that dopamine feel.
And so what we'll do is I'll tee them up, I'll save them. And one of our rituals is that once she gets into bed, I'm usually in bed first, we'll watch like one or two of those together with the red light filter on. They're not stimulating. Mm-hmm. They're not like scary. They're not news. They're not that. They're very calming videos where a very creative sort of film storyteller is talking about some interesting thing. They usually have nice light level music that's there in the background. We watch one, we watch two, and then we're like, all right, we feel like kind of sleepy. Yeah. So it's part of our soothing thing, but it is on a screen. And my wife mentioned to me when we first moved into our new place, she's like, you know what, we should put a TV in here and we could watch them on there. I'm like, that's just going to be a really, really bright light. Yep. I'd rather just watch it on our phone. Yep. Sure. Is it ideal? No, but it works for us. So I'm just being transparent about that.
Yeah, no, that's super interesting. I think your point is great, which is like, we all have to find what works for us, right? We started off this, discussion around a lot of the sort of scary stuff about, sleep and not getting enough across a wide variety of health conditions, right? And so there's certainly people that who are really poor sleepers. We want to be more aggressive and more careful about things. And then there's people who are, relatively don't have an issue, who still could benefit from some of this, but it's not as urgent, right? So yeah, the most effective, best case scenario is going to be, do it all, do it perfectly. That's going to be the, most robust outcome for your sleep. And then the least effective thing is to do none of it, right? And then there's this whole somewhere in between, right? Where we get to the N of one of like what's good for us as an individual.
If you would say the three biggest things that have had an impact on your sleep for the better, like your personal sleep, right? What would you say?
Yeah, easy. 10 or 15 minutes of morning light exposure.
That's number one.
Yeah.
That has, and how long have you been doing that?
I've been doing it somewhat irregularly for a couple of years, and got much more invested in it recently after some discussions I had with a really amazing researcher colleague of mine who said that he's done some research on HRV and shown that hands down of all the sleep hygiene hacks was the most effective for bumping up HRV and improving sleep. So I was like, okay, cool. I'm gonna get back
so
into
that's
this.
great to hear that that's your number one.
Yeah.
Because we have a whole section that you've put together where you're walking us through all that, but it's nice to know as we're sort of in the middle of the podcast, like for everybody who's listening, like that is your number one.
So that I would say it's tied. So it's tied with that. So, and it's interesting because they're both light. So it's tied with that, get that morning light exposure with not having the evening light exposure.
Yeah.
And to your point, I'm curious to check out that red screen, because for me, it's pretty clear that even if I use the night shift mode on my phone, which I actually keep it on 24 hours a day because it just feels better on my eyes, even if I use that with blue light blocking glasses, that's not as effective for me as not being on my screens.
Oh, I think not being on your screen is definitely.
So I want people to just have that in the back of their minds, because we can cheat the system a little bit, but you're not going to totally get away with it, right?
Totally.
So try some time, try 10 days, 2 weeks, if you can go as long as a month of simply setting a timer when you just don't get on your phone. I think for me, what gets tricky with that piece is like I still use my phone as my alarm to wake up in the morning.
As most people do.
Right. But just having it there by the bedside and, pick it up to put the alarm on and, not all the time, but maybe 30, 40, 50% of the time, I will end up doing something on my phone for anywhere from 2 to 10 or 15 minutes, which I didn't intend to do, because it grabs me and it sucks me in. And the devices are just so powerful for that, for how they're designed to capture us and capture our attention, right? So I think one hack on that is to literally get an analog alarm clock, and preferably one that's not lit up, doesn't have those red letters. Like anytime I go to a hotel, I'll cover that with my washcloth from the bathroom, whatever, right? So, but it just doesn't generate light in your room and is analog. And if you can, just leave your phone out of the bedroom. I think that would be super effective. So that's 1 and 2 tied. And then the third one for me is not having any food after 7 o'clock. That's really effective.
That's awesome. I love it. Anything you wanted to say more about like the sleep cycles and stages? If not, I think that, I think we're good to go into breaking down some of the, actually, before we break down some of the tips, I think it's worthwhile touching on sleep apnea under the context of sleep disorders, because it's so pervasive. And I'm sure you probably find many patients who think that they're doing everything right, but sleep apnea in particular being one of the biggest disorders that's impacting people's sleep. So we mentioned that a lot of people know of like sleep apnea and think of an overweight, often male, who is wearing a machine, sleep apnea machine. But there's this whole subclassification of even healthy people who are dealing with a lot of sleep apnea. Do you see a lot of those in your clinic?
We see a lot of sleep disorders, yes. And it frequently surprises us. Yeah. Younger, non-male, non-overweight. And I think that, there's a lot of, it can be a lot of correlation with other conditions, other health conditions too.
Did you read the book, Breath by James Nestor?
Love that book.
Yeah.
Such a good book.
I'll just try, we've had him on the podcast before, but one of the big things that he's saying is that the reason that we're having so much disordered sleeping, and sleep disorders is a big thing. There's a lot of different things that fall into it, but the narrowing of the jaws and that impacting our ability to sleep properly. And actually, as part of landing that plane, our mouth and our tongue getting into the right position and allowing us to breathe properly.
Yeah.
And when we're breathing through the nose and our tongue is pinned to the roof of the mouth, we're much more likely to be breathing properly, which allows good sleep. And when we're not, and our tongue is flappy, or our tongue is too big for our mouth, which our jaw is too small, that can cause a lot of issues. And then some people have a tongue tie that was never corrected. Yeah. Anything else you want to say on the jaw sleep connection, sleep apnea connection?
Yeah, no, great points. If you haven't read James Nestor's book, and I've heard it both ways, whether Breath or Breathe, the title, but just an incredibly well-researched, really fast-paced, really fun book to read. And there's a lot of factors there that he talks about that are not in our control, right? It's evolutionary, in part, the shape of our skulls as we went from being, walking around on four legs up to standing up on our feet and legs, and then the growth of the brain, and then how that pushed the nasal cavity forward. So a lot of that, contributes to the mouth structure and the narrowing of the airway, but there's a lot that is in our control, and, pretty interesting things around breastfeeding, right? So, duration of breastfeeding is definitely associated with development of the whole oral cavity and the strength and the tone of the muscles and the tongue also, which then sets you up later in life to have less airway issues. Same with, what are we feeding ourselves as children or feeding our kids, and what are we eating ourselves? And if we're eating a really soft processed food diet and we're not chewing our food carefully, we're not developing these muscles, which are also important for keeping that airway open. I think that happened to me.
I have a very narrow jaw, and I've been, working with dentists. Yeah. I have a dental appliance.
Yeah, like an ALF or a...
it's a custom made one. There's a dentist over here in LA
block.
that to expand my palate, because my jaw was narrow, and it wasn't really an issue growing up. I didn't notice it too much. I always slept great. I didn't have any sort of sleep apnea type things. But then something maybe happened in my late 30s where I started to notice that it was creating a lot of almost TMJ type symptoms. And then I went in and got referred to this dentist, and he created this dental appliance. And around the same time, from another dentist, Dr. Mark Bahena, who's up in the Bay Area. I don't know if you guys have met each other, but he was the one that really got me into mouth taping, which has been a total game changer. For me at night, and we've done episodes and other things on that. So
so if we're breathing through our mouth as opposed to our nose, the nasal tissue actually gets more swollen and boggy, and then it sort of propagates that cycle. It gets harder. It keeps
and we're not producing nitric oxide when we're breathing through our mouth, and a whole bunch of other things.
So one other thing, and then we can move on. But like the other thing I think is really interesting, and pretty rapidly, we've seen problems with airways around screen use. And so, because our posture should really be like a J-shaped posture, straight and then kind of curved into the bottom, from like this. Whereas if we're on our screens and we're, kind of, you've seen everyone with like screen neck, right? Where we're kind of tipping forward.
Tech neck, right?
Yeah. And that's creating an S-shaped curve, which further closes off the airway.
Wow.
Right? So another thing you can do is, posture is incredibly important. Sitting up straight, keeping your shoulders back, standing with your head, almost like you had a plumb line dropped from the crown of your head all the way down through your shoulders, your diaphragm, your hips, your knees, your feet. So you have a nice straight posture there.
Which it feels like, a lot of people try to work on posture during the day, but I found that in my anecdotal, just watching people, really, if you want to fix your posture, it's walking more in life, not sitting as much, and then working out.
Core.
Because if you work out,
core work,
but also strengthening your shoulders, that's naturally going to lift you up, and not so much tension that's going to be there on your
and
on
stretching
your neck.
Too. Because again, we are unbelievably dominant in terms of like this hunched over position. We're always looking down. We're typing. We're on our phones. We're reading something. In this developed, modernized culture that we live in, right? So, at the end of the day, one thing I like to do as part of my wind down routine is do something that's the opposite of that. Lay on your stomach and clench your shoulder, pinch your shoulder blades together as if you're like pinching a tennis ball between them, and activate those back muscles that are the counter muscles to this kind of collapse, right? Lay on blocks that keep your arms up like this, and it just pushes your shoulders back. You can do that when you're driving too. Just like literally push your elbows into the seat of your car to activate those muscles in the back. So that can be helpful to, again, counteract that, general tendency that we all have.
It's a great tip. There's a dentist named Stephen Lin who's based out of Australia, and he had a great post on social media on the topic of sleep disorders and sleep apnea. He said, if you're snoring, you have to think of snoring as choking.
Yeah.
Snoring is choking. Anytime you hear somebody snoring, that's choking.
Yeah.
And
the airways closing is vibrating the tissue. That's the sound.
And we wouldn't treat it as something that's just funny or annoying or whatever. Even my dad, for years in his life, was snoring.
Yeah.
And my mom would always joke about it and like, she can't sleep as well, but she got used to it. Then finally my dad went in for a sleep study and saw that his sleep was dramatically being impacted and the choking that was happening with him snoring. And then he ended up getting a CPAP machine.
Yeah.
And now they're so much better. These devices, they're so much smaller. They're so much easier to travel with. They're easier to use. In fact, one of my buddies that I wrote about in my newsletter, his name is Mihir, Mihir. He was willing to put his story out there. On his journey of weight loss, he hit a plateau, and then he found out that his sleep apnea, his functional medicine doctor helped him understand that his sleep apnea was connected to weight loss. He fixed it by getting a CPAP machine, mouth taping, a few other things. He lost an extra 10 more pounds
awesome.
Just by fixing his sleep.
Inflammation, hormones. Yeah.
It's all connected to each other.
Yeah.
All right. Before we go through solutions, anything else that you want to touch on for sleep disorders that you want to mention to people?
Yeah. Again, I want to just kind of go through, there's this questionnaire called the Stop Bang questionnaire.
Okay.
I think everyone should just go check that out and run themselves through it. You can do it online.
Stop Bang.
Stop Bang. So it's a mnemonic. So S is for, do you snore loudly? Again, our discussion is important, which you don't have to snore, but it is definitely a tip off. I think your point is great. That's a sign of
So this is like a yes or no questionnaire. We can link to it in the show notes as well.
Yeah.
So you're answering like, do you snore loudly?
Do you snore
yes
loudly?
Or no?
Do you often feel tired? Is T is for tired, fatigued, or sleepy during the day.
Yep.
O is for, has anyone observed you stop breathing during sleep? Because that's apnea, is like a halt with sometimes a gasp, right?
Yep.
And then the P is for, have you ever been treated for high blood pressure?
Mm-hmm.
And then the B is for BMI. With your BMI, are you heavy? Are you overweight? Are you obese? That's a risk factor. The A is for age. Over 50 is a risk factor. Neck circumference we talked about is a risk factor. You can look at the parameters there online for men versus women. And then gender, being male, is also a risk factor. Yeah. So I think just getting yourself screened, figuring out what your score is. Could this be a problem? How is my sleep? Do I snore? Has anyone said I've stopped breathing? Is my wife not annoyed at sleeping next? My husband, etc. Get a sleep test, because there's so much profound benefit that can happen from that one intervention that you just talked about. That it's just so easy and high yield.
Here's another one that I'll add in, and again, I just know this from James Nestor. We were on a panel together at the Milken conference. And he's saying, I'm seeing this epidemic of young, healthy women, again, with narrow jaws. They're not only are they not overweight, some of them might even be considered underweight, right? So they're not in the classic sort of thing. They're young. They're in their like 20s and 30s. And they're waking up first thing in the morning with like a lot of anxiety.
Yeah.
And if you're waking up first thing in the morning, you have a lot of anxiety, it's a sign that your body was stressed out the whole
your cortisol
night.
Spiked. Yep.
And you have not been able to relax. And that could be an airway issue.
Absolutely.
And you need to dig into it a little bit. You might be missed by your normal doctor if they're looking for all the classic examples of sleep apnea. But again, you could pick up his book and listen to our podcast. We talked about it a little bit more over there.
Yeah, and CPAP can be very, very helpful and really important. But there's more simple things too, like various oral appliances. Working with someone who's called an oral myofunctional therapist. They actually teach you to do exercises and to work on the strength and tone of your muscles in your mouth and throat. And mouth taping is really amazing, and being evaluated for a tongue tie. You mentioned that, but that's like where there's a little tight connection at the bottom of the tongue, which is surprisingly common, and it prevents the tongue from going to its most beneficial place, which is again up at the top of the roof of the mouth against the front teeth. That also helps to open up your jaw. That pressure over time, like water on a rock, over the course of your life is going to push your teeth out and open up your whole jaw. And if that's not happening, you could have a small jaw, a small airway. Weston A. Price was an amazing dentist, Nourishing Traditions, Weston A. Price Foundation. He showed that it's kind of a modern disease, and it's largely related to our lifestyles, our nutrition, poor nutrition. That a lot of us do have smaller jaws and airway issues too.
Definitely. I'm in that boat and I've been fighting against it.
I'm glad you know about it and you're working on it. So
totally. So we've mentioned a lot of these solutions. Right now, we're going to get into solutions here. We've talked a lot about these. So some you might just want to give a little bit of a refresher. And then if there's some new information you want to share on it, great. So I'm going to walk through a list that you gave me. So one of the first ones on the list is, again, the importance of having a bedtime routine, right? We talked about your top two. which are part of this as well. But I'm just going, listically through the list that you have. So the importance of a bedtime routine, a regular, predictable time that you are falling asleep, but also a time that you're winding down to get into, as you mentioned from Matthew Walker, sleep is not like switching the lights off, but it's more like landing the plane.
Yeah.
Anything else that you want to share when it comes to the topic of having a bedtime routine?
Yeah, so I think we have gone through a lot of that, and we've given a lot of good information on that. I think just reemphasizing that the bedtime routine actually starts in the morning. And so, because a lot of people, might, not recognize that, but that importance of how you structure the first part of your day, timing of the whole course of your day, really.
And that means like getting the morning light.
Getting the morning light,
Right.
timing of caffeine, timing of food, blood sugar balance,
Yep.
Stress,
And for your morning light, are you leaving your house? Are you sitting on your balcony? How are you typically doing it?
Yeah, I find for me the best, it works the best if I go outside and I walk.
You walk. That's how you enjoy it.
walk. And I'm very fortunate. I live in an area right next to open space, so I can literally walk up into the hills and be in nature. And so there's a whole nother level of, Shinrin Yoku, forest bathing, being in among trees and grass and wildlife, which is a whole nother set of benefits for, health and neurotransmitters, et cetera. But you don't have to be in nature, just being outside, being in the sun. If you don't wear sunglasses, don't wear a hat. If you wear prescription glasses that also have some blue light blocking built into them, try to not wear those if you can safely. I don't want you to trip and fall. But, if you have a pair of glasses that don't have that blue light blocker in there, wear those. And
how important do you think it is, Andrew Huberman, who's really been really championing a lot of this and his work at the Huberman Lab, he typically says within the first 30 minutes, right? From the time that you wake up, like try to get out, again, that's what he's saying is like an ideal situation is to try to get morning sunlight without like a window blocking you or anything else like that, sunglasses within the first 30 minutes. Is that?
I think it is important, but it's not required.
Okay.
Again, that idea of, the worst, the least effective is going to be not do it at all.
Totally.
Right?
So just get out sometime in the morning,
outside.
Go for a walk.
If you can walk, great. If you can't walk, just sit outside.
Sure.
If you can sit somewhere outside, if you can do some stretching, that's great. Also, it doesn't have to be in the sunlight, right? So if it's a cloudy day, you don't necessarily get a free pass, because just being outside, even if there's a cloud cover, will still have those benefits for, and again, I think what Huberman's talking about with the timing is that the sooner you do it to when you wake up is you're basically activating this receptor in the back of the retina, which is called the melanopsin receptor. And this receptor, again, is that start point of your circadian rhythm. It's saying, drawing the line, here is the start of the day, so that your body kind of knows where that is, so it knows then better when the end of the day is. But in addition, when those melanopsin receptors are activated, you start to clear more rapidly any residual melatonin from natural sleep. And so you feel more awake, you feel more rested, you feel less groggy, and you wake up, right? And so, get outside any way you can do it, and when it's dumping rain and I'm not necessarily going to gear up and go outside, I'll just sit by a window where there is some good light coming in, and do some stretching there, right? But it is, I feel it. I don't feel I don't feel it as powerfully at that point.
I love it. We've touched on light a lot, but let's talk about any other things when it comes to the light that's around us. We talked about morning light and the sun. Any general practices, like you talked about turning the lights off at a particular time, but do you try to dim the lights?
Yeah.
Do you avoid super stimulating lights, especially at night?
Yeah, I think your point really drove it home, was that if you're in an environment where there are a lot of really bright, these sort of blue light, white light, LED lights that are creating this kind of like, wow, it's so bright in here, I can see everything, almost daylight environment. And they're coming from an overhead position where they're directly hitting your eyes, that those are more stimulating for sure. So, if you have some floor lamps that have, a hue of light that is more soft, there's more yellow, orange, etc. There's a bunch of these you can purchase from a variety of different manufacturers. There's even some which you can set to change tones at different times of the day, from the different manufacturers. I don't think those are completely necessary. They're more expensive, but again, something which is not going directly from above into your eyes and is not super bright and white, So you have a variety of lighting options.
Do you have a favorite type of blue light blocking glasses?
I use a couple of different ones. I have the big ones that look like you're a grandpa and you're driving the old station wagon. They kind of cover everything and sides too. I don't use those as much. I have ones from Swanwick that I like that are more of a a stylish form factor for what that's worth. But again, there's a lot of options out there. There's a lot of good manufacturers, but I would definitely recommend that you get some where you put them on and the lens looks orange, right? Because there's so much advertised as being blue light blocking, but they're clear, and so you can't really see it, right? And those are not going to be as effective. There's some wiggle happening in this field. I think there's some research coming out recently too that question maybe the efficacy of the blue light blocking glasses. But I still think added together with all these different factors, it can be potentially beneficial.
So I'm going to pivot and we're going to go to diet. You talked about that previously, but tell us what you recommend to your patients when it comes to diet and how it's related to sleep. One of the first recommendations that you shared was like not eating too close to bedtime.
Yeah.
So that one you've talked about. Is there anything else we should be thinking about with diet?
Yeah, I think one of the other very important factors is to consider, what's happening with your blood sugar. We talked about that a lot, but you can get some clues into how your body is handling carbs and sugar by asking a few questions, right? So, what happens to you during the night? There's some clues that blood sugar or carb intolerance might be affecting you. Are you waking up consistently 2 or 3 in the morning, right? We talked about that earlier, but blood sugar imbalances can also be another factor for that. Do you wake up to pee, but then you feel really hungry, right? Some of my patients will actually get up and have a meal or have a snack in the middle of the night because they're super hungry, right? What's
going on there? I think a lot of people, there's people that are dealing with that. I've never dealt with that before, but what's typically happening when you notice that?
Yeah. So again, dysregulation of those hormones that are cluing you into either I'm full or I'm satiated. Right.
So maybe too much blood sugar roller coaster throughout the day.
Blood sugar roller coaster. Yep. Insulin. So basically, if you're on this blood sugar roller coaster and you eat a simple carbohydrate, and your blood sugar rises. You maybe without a fat or a protein, your blood sugar rises, and then that's chased by insulin. The insulin tries to catch up with it to bring the blood sugar back down. But then the blood sugar drops. Now the insulin is a little bit of a lag to how quickly it pulls back. It's still some residual, so blood sugar might drop too low. And then you might, want some sugar. You'll crave something sweet or, carb, or you have to mobilize some stress hormones in order to pull some carb or some glucose out of storage in the liver, right? And so you'll be on this, like, you're basically chasing your tail throughout the whole day.
Do you ever find, I hear anecdotally sometimes from people that say, if I don't have some carbs at night, I don't sleep as well. Yeah. Like if I don't have like sweet potato or something, or even sometimes people say like, I'll have a little bit of pasta and I sleep much better. Do you ever notice that for patients? And what's typically going on there?
Yeah. So that's a flip side, which is that, some of the precursors to hormones, right? Like serotonin and neurotransmitters like serotonin or melatonin, do need those carbohydrates, and that when you also prime the pump and kind of give yourself enough of that sustenance to get through the night. So there's a couple of different factors involved.
And then obviously in that instance, if that's you and people can experiment, you're just looking for whole food sources of carbohydrates.
Exactly. Like you mentioned, sweet potato or some yucca or some plantain, but trying to avoid the, as Mark said, I think in Ultra Metabolism, one of his first books, it might have been his first book, avoid the white menace, right?
Let's talk about gut health. People don't think of gut health as being related to sleep. What do you want to talk about when it comes to that area?
Yeah. So obviously just a really incredible time, it keeps building in terms of the literature around the microbiota, the microbiome, and how important all the organisms that are in us, on us, and around us are for our overall health. But there's really some interesting research on gut bacteria and that they can be responsible for helping us to create vitamins, especially B vitamins, and also neurotransmitters like GABA or 5-HTP, which is the precursor to serotonin. And then these are all linked to better sleep, right? B vitamins are linked to sleep quality and duration, and also are needed for production of melatonin and cortisol. And if we don't have those B vitamins either from manufacture by our gut bacteria, or we're not getting them in our food or by supplementation, we might have a deficit in those processes, which will then have this cascade into our sleep. The gut actually has a huge amount of melatonin in it. It's a production site for melatonin in addition to the pineal gland, right? And so if your gut health is poor, you have dysregulation there, you're also going to kind of go into your night or your week or your month with a low store of melatonin, which is going to give you trouble marking, again, that start point of sleep and helping you get to sleep. There's a lot of interactions there with GABA, again, 5-HTP. There's also a huge amount of 5-HTP and serotonin that's manufactured in the gut. And so again, dysregulated gut and inflamed gut, a situation where we have intestinal permeability, you have that local production disruption, but then you also have a systemic, circulatory deficit, as well as now you start to develop brain permeability and sort of a leaky blood-brain barrier with further inflammation and further disruption of sleep.
So just, we're not going to do a whole deep dive on gut health. Maybe we'll have you back for that in the future, but just top 1 or 2 or 3 things that support gut health, like things that you either want to do or things that you want to not do. Let's start off with the not do, things that we want to avoid to have just like, the best gut health that we can. So I think the number 1 would probably be like just being mindful of ultra processed foods.
Exactly.
Right. Ultra processed foods on a regular basis is going to throw your gut health off. Yes. Anything else that you want people to be thinking about when it comes to the, staying away from or avoiding side?
Yeah. So if you know that there are foods that cause you any reaction, you definitely want to avoid those because those are causing inflammation. Those are going to contribute to intestinal permeability. Absolutely all the processed foods, pesticides, coloring agents, preservatives, et cetera, those are toxic to your gut and will cause damage to your gut cells with downstream negative effects. Any other factors, which, I would say sugar is a big one as well. Sugar, again, leading to imbalances of the gut bacteria and dysregulation in the gut bacteria with then a sort of stair-step process into inflammation, intestinal permeability. I think the things to work on in addition would be finding out if you have things that need to be removed. And those are, any hidden infections, any bacterial imbalances or dysbiosis, any parasites, or fungal overgrowth, or, things that you've accumulated over the course of your lifespan, almost like barnacles on a ship, which are causing a drain on your system and causing inflammation and intestinal permeability.
And in most cases, that's probably something that you're going to be best off working with a practitioner to help you kind of dive into. It can get very complicated. It's a very, there's plenty of things you can do on your own, right? Like actually, maybe let's list a few. Like we know generally, getting adequate levels of fiber, right? We had Dr. Will Bolshevitz on the podcast.
Yeah, that was a great show. I love that one. Yeah.
Deep dive on fiber and how to get it.
Soluble and insoluble, especially soluble, which feeds our, butyrate producing bacteria and creates an anti-inflammatory environment in the gut as well as the whole body.
Yep. So, fiber is really one of the best ones that are there.
Yeah.
And then if you can tolerate it, or working yourself up to some regular inclusion of fermented foods.
Yeah. Fermented foods. Yep. Yeah. Probiotics, prebiotics, ideally in dietary source, right?
Yeah.
But as supplements too, if those are helpful to you, and then, making sure you're moving your bowels, like super important as Dr. B said. If you're not pooping regularly, ideally at least once a day with a nice formed bowel movement, check out the Bristol stool scale and kind of rate your bowel movements and see where you land. And, you want to be in that 3 or 4 range. And if you're not, there's a clue there's something going on that you want to problem solve. That has, really incredible downstream importance for almost every health condition.
Okay. We talked about movement, big picture. But anything specific that you want to mention about, just exercise and its relationship to sleep that we didn't touch on?
Yeah. So, just, pretty profound benefits and pretty profound, do this and have this outcome in terms of if you're exercising, decreasing sleep latency, increasing deep sleep, increasing sleep duration, improving your blood sugar balance, a couple mechanisms we talked about, increasing your adenosine, that compound that we talked about that bumps up your sleep drive, right? That's kind of why you feel more sleepy or more tired later in the day when you've had a good workout or you've gone for a good hike, et cetera. So yeah, those are some of the key factors there.
Awesome. mindset shift and practicing mindfulness.
Yeah.
I know this is something that you're a big fan of. People notice that one of the reasons that they have a hard time falling asleep is that their mind is just so busy, or they feel that their mind is so busy. And often that's because they're trying to crash land the plane after,
Right.
it being super stimulated
Right.
and the mind doing a lot of different things. So that plays a part into it. But for people who still feel like, my mind is too busy, or I'm having a lot of anxious thoughts at night, are there things that can be helpful for them?
Yeah. So teasing apart those two things, mindset shift and mindfulness is one thing, and then sort of brain dumping or getting rid of the mental noise is another one. And the research around gratitude and appreciation, so mindset shifting, and also mindfulness is staggering. It's hands down super robust, but it's also extremely simple. And one of the things that I adopted a number of years ago that I saw on Kelly McGonigal's Twitter. She wrote the book, The Upside of Stress.
Exercise, right?
Exercise. Yeah, that was a newer one. The earlier one that she did, she says there's several amazing books, but it's called The Upside of Stress. And, the power of shifting our perception of stressors and our mindset, the power of mindset, and how that can affect how we experience our external environment, right? I did this last night. I do it almost every single night. Sometimes I fall asleep even before I'm done. But, put a sticky note on your bedside table or on your lamp. After a while, it becomes second nature. And the sticky note just says someone, something, myself. And so then the goal is just to before you go to bed, when you're laying there in bed, think of someone you're grateful for and why, something you're grateful for and why, or that you appreciate, and then something that you're grateful for or that you appreciate about yourself. And the more you can activate that feeling, really put your hand on your chest and really you're being grateful to yourself, being like, I did a great job today. It's a little hokey, but if you can activate that sensory experience and those brain pathways, really incredible release of feel-good neurochemicals, oxytocin, serotonin, et cetera, which really help with sleep.
I love it. We're not great at celebrating ourselves.
Yeah.
And there's so many people that are out there that speak worse to themselves than they would an enemy.
Absolutely.
Right?
Yeah.
You speak so harshly to yourself. You don't acknowledge yourself. You would never speak to a child that way. You would never speak to your partner that way. You'd be way more encouraging. Well, we want to be encouraging with ourselves. And part of that is gratitude and acknowledging. Who was it? I forgot his name. He's been on this podcast a couple of times. He says the brain is like Velcro for negative.
Yeah. No, our negativity bias.
Negativity bias.
Scanning it as a survival.
And Teflon for positive things, right? The positive things in our life just slide right off. The negative things, they stick to us. So we have to wind down and be grateful for the things that are positive in our life.
Yeah, we need to be our own cheerleader, and we need to recognize Richard Schwartz. If you have not had him on the podcast, you might look for him. He's the creator of internal family systems work, which is basically his book is called The Sum of Our Parts. And that, there's no bad parts of ourselves. They're all there for a reason. They've all been created from some historical event or maybe trauma as a protector. And so if you have a voice inside your head that's, anxious or negative or telling you bad things, you have to kind of go towards it and be like, I hear you. Thank you for trying to help me. I appreciate what you're trying to do, but would you mind just stepping to the side a little bit? I want to talk to this other voice, or I want to get this thing done today. So yeah, they're all there for a reason. So
yeah, our thoughts that go crazy at night, one thing I've found that's been helpful for me, I learned this from a mentor of mine, Serrano Kelly, many years ago, and people have different takes on this, but it's basically a brain dump. And the one that he kind of taught us more specifically around sleep is that, let's say you have a journal or even a piece of paper, and let's say your mind is very active. Well, a lot of that activity is your own ego, your default neural network, kind of worried about what's going to happen in the future if you don't address stuff. Yeah. And I think a really good practice is to take a piece of paper and just start writing it all down. Yeah. So I'll write at the beginning of the sheet, I'll write, just brain dump or mind dump. I'll write it down. I'll keep on writing. Okay, this other thought. Okay, I'll write it. And a lot of people do that, but I think the thing that really works, especially at night when you're sleeping, is make sure it's a piece of paper. You're not doing this on your phone. You fold it up and then go take it outside of the room and put it on your kitchen table, go put it somewhere else or put it in a drawer, right? And literally I've told friends this, you just put it away and you say, tomorrow's another day.
Yeah.
Right?
Nice.
You have a whole other shot tomorrow to tackle all this stuff. And I find that when you capture it, your mind starts to quiet down naturally because it's not so worried that you're not going to do something about it.
Or you're going to forget it.
Yeah.
Right. Because it's trying to hold on to them and make sure in the morning I remember to do so-and-so. Right. Yes, exactly. Don't have it be your phone because you'll get distracted and you're activated by light. But yeah, that brain dump and also like stream of consciousness, like you'd be surprised what comes up. Try to keep the pen moving. Just keep it moving for, if you can do 10 minutes, that's great. Your point, I love that actually. I haven't done like put it outside of the room. That's a nice like, psychological move.
Put it outside the room, like physically, I'll come back to this another time.
And the other thing that I do actually like also is to actually have something by the bedside table. For those people, my patients who do wake up in the middle of the night with their mind racing and trying to, keep track of everything, they're anxious or worried. You can buy pens that have a light in the tip of it. So you just click the pen and a little red light will come on. You can buy them in different colors. Definitely get the red ones. And then you can have a little, book or a little journal with this light up tip pen. And if something comes up in the middle of the night and you want to jot it down, you can put it down. That way it's safe. It's there. You're going to get it in the morning. You don't have to think about it. You don't have to hold on to it. You let it go. Brain dumping, right? And so that's really profound because again, that landing the plane analogy, like we're coming into bed with like this swarm of things in our head that's going on that we're processing, and everything from social media memes to emails we have to send to stressful relation, whatever it is, right? And so having a home for that, having a place to put it as a ritual is really powerful.
Let's talk about temperature and cooling down before sleep. I think this is one area that in particular seems to impact a lot of men. When I get hot at night, I immediately will wake up. And so dialing in my temperature, for me, the biggest game changers have been temperature, which means like getting the house to be cool, cooling down my core body temperature, which sometimes can happen by heating up and then kind of cooling down a little bit. You'll chat a little bit more about that. But then also at night, I have no affiliation with them, but I use like a 8 sleep, like something to keep my side of the bed, not my wife's. Otherwise she would smack me, but my side of the bed cool. And I can end up sleeping a little bit longer. And then when I can, opening the windows to also let in a little bit of fresh air. But what do we know about cooling down before sleep and how that's related to better quality sleep?
Yeah. So temperature is one of the things that is a key part of your circadian rhythm. And it fluctuates during the day on a very regular cycle, along with a number of the other factors that we've talked about. And a drop in body temperature, which again, evolutionarily is happens because you're outside and you are being exposed to the elements, and that's just what the environment is doing. But that drop of body temperature that our body syncs up with creates sleepiness and helps you fall asleep. And so if we're keeping our house warm and, we get under warm covers and, don't have any fresh air, we're not experiencing the opportunity to augment that or to harness that, right? And so, to your point, you can hack that, right? By taking a hot shower or getting in the hot tub, 20 to 30 minutes before you want to go to sleep, or even up to 60 minutes before, because then you have heated your body up, and then getting out is a relative cooling. And so that relative cooling that kicks in tells your body, okay, sleep's coming, get ready to go to sleep, right? And so certainly there's devices out there now. I haven't actually personally used one, either the 8 bed or the chili pad is another one. But, certainly like keeping the room cool, cracking the window, cracking the door, getting some air in there. The temperature ideally should be, down in, mid to high 60s, ideally, in my opinion.
Yeah. I also noticed that, if you sleep in the bed with somebody else, I think sometimes, you have one person that prefers it a little warmer, one person that prefers it a little bit cooler. And, these devices, 8 sleep, chili pad, they're expensive for people. And if you can't crack open your window or that doesn't get it cool enough, I tell people, have separate comforters or one person just have nearby the bed, a lighter blanket so that by the time you fall asleep, you can just switch over to that and you can keep cool and then your partner can stay warmer, right? Like, but Absolutely. If you're both under the same sheet or the same comforter, I find that you will also radiate each other's heat, and then both people get hotter.
Yeah. And if one of the person's a restless sleeper and they're tugging on the blankets, so I'm a big fan of, at the minimum, separate blankets, so that you're not, moving the other person around during the night. That way you can also adjust temperature. But I want to also destigmatize the concept of sleeping in separate beds. And so some couples, will choose, especially if one of them is a restless sleeper, will choose to sleep in a separate bed. And you can still have cuddle time and intimate time. And then, maybe spend part of the night together, but then, switch beds, et cetera. Really important, because I think there is some stress that develops, right? There's some, interpersonal stuff that can happen where the person who's maybe the more steady sleeper is getting a little annoyed. They want to just be able to sleep. And then the person who's the lighter sleeper has also been a little worried. Okay, I'm not going to try not to move because I don't want to wake up, my partner. And, so it's not, there's some fear around that. Like, does this mean we're going to get a divorce or we're going to split up, et cetera, et cetera. If anything, it might be the opposite. It might be actually a healthy response to, especially if somebody has sleep apnea and they're snoring all night. Don't be shy about getting your own space so you can sleep well. It's, again, super important.
We're going to go through a few things, just maybe rapid fire.
Yeah.
That we've touched on a little bit, but just if there's anything that you want to chat about, caffeine, I think your big takeaway is, again, caffeine has a half-life of, I've heard, like 8 to 9 hours. I think I wrote 9 hours one time in my newsletter, but maybe I had it off. But it's around there somewhere.
A little bit variable depending on genetics, yeah.
Depending on genetics. So typically, what's the curfew that you tell your patients to kind of cut things off at?
10 a.m.
10 a.m. Okay, great. So I have to take my 12 noon and I got to move it up a couple hours to be in an optimal position, and then see if it makes an impact. Alcohol reduction or elimination? What do you want to say about that?
Yeah, so alcohol is a sedative, and it doesn't really help sleep. It doesn't really help any of the physiological aspects of sleep. In fact, it may harm some of them. It might alter your sleep cycles. Ideally eliminate. There's a recent study that came out that there might be increased mortality risk even after just 2 drinks a week. And so, the people always ask, does that include red wine, et cetera? And in fact, I think it did. And so, minimal alcohol, once in a while you make the choice, to have fun and to have that stress reliever. That's fine, right? But if it's a 4 or 5 night a week thing, I think that does potentially, and you're having trouble sleeping, I think it does play an important role.
Use your bed for 2 things. What are the 2 things we want to use our bed with to really bring a sacredness to our bed?
Yeah, ideally the bed should be reserved for sleep and sex.
And what are people using it separate from those things like that are maybe bad habits?
Yeah, well, so we talked about some of them today, right? But you might go into your bedroom and have a big TV in there, right, and watch movies, or be on your devices, or sitting in your bed with your laptop on your lap doing some emails, or reading. I'm a big fan of reading, but what's your choice of what you're reading, right? Are you reading a high-paced, Jason Bourne adventure, which is getting you all keyed up and excited, and you can't put it down because of violence and action? Or are you reading, something much more, calm and mellow and even romantic, or so there's things there. Eating, obviously, right?
Eating.
Don't eat or drink in your bedroom. And besides the fact that, that these can all have specific effects, negative effects on your sleep, there's also this idea around you're telling your brain what to expect.
Right.
So if you're having trouble sleeping, if those are the only 2 things that are happening in the bedroom and everything else is happening outside of the bedroom, over time, relatively quickly, your brain learns that these are the things that happen in the bedroom, and you have a much easier time of landing that plane, right? Because you're not having this kind of distraction happening.
Totally. All right. There's an ultra bath idea that you have, which can be a super useful way to help people get ready for bed.
Yeah, super simple. Again, if you're a bather, Epsom salts, taking a couple of cups of Epsom salts, which are magnesium, some baking soda, a little bit of lavender oil, essential oil, and doing that, taking a hot bath with those in it. And so you're absorbing a bunch of magnesium through your skin. The lavender is super calming. And then the baking soda can also be helpful for detoxification and for cleansing. So that hits a number of different points there.
When my wife doesn't do it every night, but when she's had a more stressful day, she's gotten now into the habit of really don't even think about it immediately, start winding down the lights a little bit, light a candle, And this basically is the exact type of bath
Yeah.
she takes. Epsom salt. She doesn't put the baking soda. What's the purpose of that?
Yeah. So again, it has a little bit of a detox aspect to it.
Got it.
Yeah.
Got
so
it.
it opens up some of your lymphatic and detox pathways.
But she does do the lavender oil. And I know
And the
that
lavender oil too, like you can just literally like have a little bottle and just smell it.
Yeah.
And take a deep breath in, and you can actually, I can feel this sort of calming wave happen, which is really sweet.
Do you ever use tools like Yoga Nidra? You know, like these non-sleep. This is sort of like to initiate sort of the winding down, like these guided meditations. Do you ever recommend any of those for people?
I haven't done a lot of that, but I think that falls into the paced breathing for me as well.
They're like, I don't know if you've done Yoga Nidra yourself, but it's like a body scan.
Yeah.
So it's like it's like there's some really great ones that are on YouTube that don't have ads in between them. So like even if you don't have YouTube Premium, you can I'll link to a couple in the show notes. I have one that's like 30 minutes. And then sometimes when I really have like my mind is so active, I'll even do one that's like an hour, to like help me really kind of wind down, even sometimes midday if I've had like a very active day and I need that.
Yeah.
But it's like a body scan.
Yeah.
Right.
That makes total sense.
Starting with the top, going down, notice your shoulders, breathing.
Yeah. That's a combination of mindfulness and also just paying attention to any areas of tension or stress. And you can really, and it has some hypnosis aspects to it too. I think you can basically get into a very nice, calmed, parasympathetic state that way.
So there's a lot of great things here. I'm going to switch over to supplements unless there's anything else that you wanted to mention on that side.
No, let's do it.
Okay. What supplements have you found to be helpful for sleep? And what are the supplements that might be a little bit overrated in how they're being used right now for sleep?
Yeah. So let's start with melatonin. I think that's a little bit overrated, and it can be helpful in some cases. But again, I think it's a little bit of a misconception. It's one of the first things that people reach for. And I think that, they're thinking of this as something that's going to keep me asleep, when in fact, it's more designed just to kind of mark the start of the night. And I think that, Consumer Reports has looked at this, and there's a huge variation of what is in something that says a certain number of milligrams of melatonin. But also, sometimes it's way overshooting. So you're taking a lot more than you thought. And that can lead to some significant grogginess the next day, right? And so it probably doesn't, studies have shown it probably does not feed back to the pineal gland to downshift your own natural production of melatonin. But it does increase the melatonin pool that's available and therefore trigger those receptors more actively, right? And so you can actually see a little bit of downshifting possibly of some of those receptors. So if you're going to use melatonin, if it's helpful for you, probably not a regular thing. I think it's more indicated for travel and for changing time zones, because you can kind of use that as an artificial, hey body, we're here kind of thing for that line. There are
also, there's some concerns, right, with synthetic melatonin. It's melatonin is like a hormone.
Yeah.
And so these are mouse studies, and I know like 50% of mouse studies, when they're translated into human studies, don't end up,
right.
The findings don't end up staying true. But I heard Andrew Huberman on the Joe Rogan podcast talk about how some mouse trials, again, it's not human trials, showing that consistent melatonin use at a higher dosage was like shrinking the testicles of these mice.
Oh, wow.
Again, it's a mouse study too.
Look that up. I have not read that.
But I've heard more and more functional medicine doctors saying like we really need to be mindful about melatonin because it's a hormone. I've seen an interesting alternative that I learned about through Dr. Deanna Minnick, who's a Institute of Functional Medicine educator. Yeah. She's affiliated with a company that makes a product called Herbatonin, and that is my go-to for jet lag. Like if I go to like New York. If I go to like London or I like have to travel to Italy and I really, really need to like time my sleep on the flight, it's a plant-based melatonin and it works great. I don't feel that grogginess that's there. Sometimes people take melatonin. What's up with this? There's this joke on like you take melatonin, especially the lower quality one from like Walmart or Costco. People have like crazy, crazy dreams.
Yeah, it definitely can increase vivid dreams for sure. Yeah, that's one aspect of it. Probably because of some of the effects it's having on improving REM sleep in particular.
Got it.
Yeah, early.
Got it. Okay, so it's a little overrated.
But if you do need it, if you do find it's helpful, you might also look for a time release one so you can better, But again, I think that the way you're using it, The thing that's tricky about melatonin too is that it's very well known. It's sort of the thing that everyone has heard about now, and you can go to any pharmacy and you can, there's like a whole shelf or several shelves of different melatonins of different strengths, and usually, really poor quality. And so just make sure you're getting, a really good quality product from a reputable distributor or manufacturer. And then, also the product you mentioned sounds interesting as well.
Yeah. Magnesium. Which ones are the best forms, and how is magnesium helpful or could be helpful for sleep?
Yeah, so there are many different forms of magnesium, and you touched on this with Dr. B on the fiber podcast that you did recently. Magnesium citrate and magnesium oxide are going to be more for bowel regularity and constipation. For brain and for sleep, you want to look more towards a magnesium bisglycinate or a magnesium threonate. These are more highly absorbed and more active in the central nervous system as well as the nervous system in general. Very calming. It's really lacking in our diets, and so we're not getting enough. And this is probably part of the sleep epidemic problem that we're seeing. But you can take this orally. You can also take it as a bath we talked about. You could take it even as a cream or a lotion.
Great. You had a few other things listed under additional herbal support. We already talked about lavender.
Mm-hmm.
Lemon balm,
herbal lemon balm, very nice. It's been used, for centuries, to help address insomnia. So very calming. You can get this in obviously a variety of different forms, including essential oils. And it's also frequently combined in some of these, sleep formulas with other things such as valerian or hops or even L-theanine. There's one that I reach for. Another one, phosphatidylserine, is really helpful, in particular if you have high cortisol around either bedtime, nighttime, or during the night. If you take phosphatidylserine, that can help to lower your cortisol levels. This is one I don't always just give, off the cuff. I frequently will use this based on testing. I'm pretty intentional about how we work with people when they have adrenal issues, because that can be a key factor. Phosphatidylserine can be super effective.
What about CBD? And then also if you touch on the topic of, cannabis separate from CBD, a lot of people use weed to help them sort of relax at night, but let's first talk about CBD and what we know about that when it comes to sleep. Yeah.
So both cannabis and CBD are acting on the endocannabinoid system in the body, which is really, really amazing and complex. There's just so many different receptors in so many different sites. And so the research on this is actually really impressive and it kind of exploding right now. There's a number of thoughts and concerns around how these compounds are extracted and what the plant source is, and pesticides, pollutants, et cetera, toxins. But, taking that on face value, thinking about these cannabinoid receptors, there's different parts of that system, CB1, CB2, are in particular most likely connected to the sleep-wake cycle. So taking some CBD can help activate that and potentially help. I'm a little cautious with it. I think that while there potentially is some upside, there's also a lot of potential downside to definitely to regular marijuana use and possibly to regular CBD use. There can be some, psychological blunting, some memory issues, and some lack of motivation, that happens. And so, I think it's not for everybody. But I think of it as one option in the toolkit.
And a high quality CBD is not really going to have any of the THC that we're really worried about.
Correct.
When it comes to the marijuana straight up. And generally I've heard that functional medicine practitioners say look for a broad spectrum, high quality, trusted sort of full hemp extract, because there's all these cannabinoids that we just don't know about that are included. And if you get it from a good broad spectrum hemp extract, you're going to get all of them, even if we maybe don't know, haven't isolated every single one that's there. Do you have?
I think so. There's also some interesting research around CBN for sleep, but hemp is a little tricky also because in order to get enough of these active compounds, you actually have to process a huge amount of the plant. And so if that plant was not grown, organically, free of pesticides, in clean soil, you really actually can bioaccumulate a lot of toxins.
Oh, that's great to know.
Yeah. And so some people actually prefer CBD that's actually extracted from the marijuana plant. And so, just a thought there.
Any companies that you know of that are good or anything like that, or people just really looking for like organic, right? Or
Yeah, we use there's a company out in Ojai actually that we like a lot that's been helpful for, and again, it's just a tincture droppers.
okay, well, if you think about it later on, let us know. And
I think it's called Ojai Energetics. I'll check that.
Okay, all right, yeah, we'll look it up and we'll put in the show notes for people that are looking for that. We'll mention two more here: valerian root and hops have been mentioned. So valerian root.
Yeah, so both of these are sort of the herbal pharmacopoeia for anxiety, for calming, and also for sedation. Valerian has a mild hypnotic effect, similar to a benzodiazepine, so it kind of acts on that GABA receptor, but without any of the risks of tolerance or addiction, etc. The benzodiazepine medicines are really like a hammer hitting on those receptors, and they are impressively effective in the short term, but very, very quickly lead to tolerance and can be extremely difficult to get off of. And so I'm really cautious. I just really, really cringe anytime I hear a patient who comes to me and says, I went to my doctor, I told them I had trouble sleeping, they gave me some Xanax or they gave me some Klonopin or Ativan, etc. And, without any like guardrails on it, just so here's 30 pills, see what happens. And because that's super dangerous, and we see people who have really just a long, like months to years of difficult time trying to taper off.
A lot of celebrities that have been, potentially their suicide or other things seem to have associated with these benzos.
Yep.
Crazy, scary.
Yeah. So, but valerian can be helpful. Usually around 400 to 900 milligrams a couple hours before bedtime. Hops also can have a mild hypnotic effect. So a lot of times these are used in synergy too. That's kind of the beauty of plant medicine. A lot of these plants will communicate to the body synergistically, and they have hundreds of active compounds that work together. And so these aren't perfect for everybody, but in some people who just need that extra nudge after they've done everything we've talked about to kind of help them wind down, these can be great.
What do you want to say about medications, the classic medications that people get prescribed on? Maybe a lot of people that are listening today are listening to this podcast because they're on a medication. Where should people be wary of these medications?
Yeah, and it's a really important point because, again, kind of going back to how does our medical system work? How much time does a doctor have? What are they going to dig in on with people? And so very, very frequently, people go to their doctor's office. They say they have trouble sleeping and they're prescribed a sleeping pill because that's the quickest thing to do, easiest thing to do. It takes a minute or two. And then, hey, what's the next thing you want to talk about? Okay, thank you very much. So people are sent home with commonly, Ambien, Lunesta, Sonata, and these are not safe medicines. They can be helpful. But we've all heard stories of people having weird stuff happen to them, right? They've taken Ambien and they didn't get in bed quick enough. And before they know it, they're like driving around, doing crazy stuff and not having zero recollection of it the next day,
wow.
Right? So that's one small aspect. But beyond that, there's studies showing that there's increased risk of cancer and increased risk of mortality with even not very regular use of these medicines. And beyond those risks, they're not really helping us sleep. They're mostly just kind of turning off the being awake. And so they're not helping us get into the proper sleep stages and get the benefits that we need to from sleep. And so we do use sleep medications when we need to. But we'll frequently reach for, sort of off-label uses of things like gabapentin. So 100 to 300 milligrams of gabapentin can be quite helpful. Low doses of something like trazodone, or even an alpha blocking medicine called clonidine. Clonidine is particularly helpful for people who have that experience of, it's 8 o'clock and instead of getting more sleepy, they are waking up. They're like, I'm ready to go. Like I'm like jazzed and energetic and a little revved up. And so that's an alpha adrenergic state. And so that medicine can be helpful. It's not without potential side effects. It's also potentially a blood pressure lowering drug. And so as we're working with the dosing, if we're using that, we tell them, hey, be careful if you're getting out of bed in the middle of the night, sit up, stay there for a few seconds, 15, 30 seconds, make sure you're not dizzy, get up slowly kind of thing until we find the right dose. But the thing I like about that, and this is what we do a lot in our practice, we always reach for the lifestyle and the natural remedies first, but we're not shy about using prescriptions, right? I think that's the beauty of functional medicine, integrative medicine, is the integration of these different sides. But we're also frequently not using the mainstream medicines. We're using sort of a repurposing or a creative use of other more safe medicines. And I think that's where a lot of the nuance happens.
Totally. My mom was working with a functional medicine doctor, and there was a lot of stuff that was going on in her life. We had recently, this is a couple years ago, we had my aunt passed away, her sister. And so naturally that's going to be something. And she had a long battle with cancer. So my mom's like sleep was thrown off for quite a bit of time, naturally, as you would expect, right? That's just a natural response to a loss, anxiety, other stuff that's there. And then she had this bout of sort of acid reflux start. And then, she was getting a lot of anxiety during the day. Yeah. And there was a really well-intentioned, well-meaning, well-trained psychiatrist that we ended up referring to, just integrative psychiatrist, to sort of just talk to her a little bit more, like what's going on with her, why is she having this anxiety during the day? My mom was like, I don't really feel like this is related to, my sister passing, but I'm happy to talk about it. And she talked and she was working, and then she was prescribed for short term. I forgot exactly what medication it was, but something to like help her out a little bit with anxiety. Yeah. Now that medication, one of the known side effects was like kind of throws off your sleep a little bit more and kind of increases the acid reflux. So her acid reflux got worse and her sleep got worse. Finally, I ended up finding somebody who was an integrative ENT who specializes in acid reflux, right? He's like, I don't think your mom has anxiety. I think I don't think she has anxiety from loss. She has anxiety because she can't sleep because her acid reflux keeps on waking her up throughout the night. Yep. He modified her diet a little bit, said, don't have these spicy foods, stay away from green tea, which is generally really good, but in her case was causing some acid reflux. Don't have chocolate, and then also let's avoid caffeine for a little while. They made all these modifications, switched some things around, and then put her on sort of a slanted pillow, which is very helpful. There's these acid reflux type pillows that you could buy on Amazon. And she did a week of that and her acid reflux went away. And then she was no longer having anxiety anymore.
That's beautiful.
And the anxiety was just a natural response to, of course, some of it could be related to the loss of our aunt, who she loved and we all missed. But it was just when your sleep gets thrown off, all hell breaks loose.
It's terrifying.
We literally thought my mom, who's this sweet person who just had never dealt with any kind of depression, anxiety, other stuff, she felt like she was going crazy. Yeah. And that's just how important sleep is to our life. And when it gets thrown off, we can do all sorts of crazy things. Yeah. So
I'm so glad that you guys found that.
And also she wouldn't have been able to unpack that without a clinician who was really willing to dig into it with her, which is another reason that I wanted you to come on, is that I've had, so many people that have worked with you that I've, talked about or heard that you guys really like lean in and you like dig because it's not, it's not often, hey, just avoid these foods, take this supplement and everything is good. For more complicated things, you really have to have somebody that knows what they're doing and kind of puts on their detective hat and holds up their magnifying glass and really tries to look at the root issues that are there.
Yeah, thank you. I appreciate that. And that's one thing that we do. We see a lot of folks with really persistent health issues that they've had for a long time, whether it's, imbalances or infections. And our motto and our team is amazing at this is, if we're dealing with these persistent problems, we're just going to have to be more persistent.
So true. There's so much more we can go on this topic here, but I think we've given the audience like plenty of food for thought. There's a bunch that if you work with the right practitioner, there's tests that you can run, there's other additional things you can do. But I think that in terms of the practical things that people can start today, I think we literally have given the definitive list, at least, on stuff that people can do at home.
One other thing I wanted to mention, there's a really exciting endeavor that I'm involved with as an advisor. It's a company called Miri. And really what we're looking at is trying to find a way to harness that possibility of using the support that people need and also technology, and in this case, artificial intelligence, to create an experience, a curated experience that basically, augments or leverages the provider, coaches, nutritionists, et cetera, with technology being part of the platform. And we're really excited because we think that so many people need this information. And as we're able to try to get that into the hands and brains of more people in a personalized way, I think it has the opportunity to kind of upend the way we're absorbing information and the way we are, digesting content from our regular sources, whether it's reading or podcasts, et cetera, watching videos. It's been a really fun endeavor to be part of.
I want to thank you for coming on the podcast, for sharing any final words about sleep and just what is possible in your life when you have it dialed in. We spent the first 2/3 of this podcast talking about everything that goes wrong when you don't have sleep. increased risk of cancer, increased risk of Alzheimer's, increased risk of cardiovascular disease, increased risk of accidents and blood sugar issues and poor insulin response. But let's leave on a positive note, which is what's possible for us in our life when we pay attention to this thing that so many people think is soft, but is actually so core to our health and well-being.
Yeah, and this is something that I've learned personally, and sounds like you have as well. But you can feel so much better, and you have with relatively simple changes, you have the opportunity to make your current day-to-day life much more vibrant and alive and fulfilling, as well as prolong your health span and your lifespan. And, so try not to be overwhelmed. I'm a huge fan of incremental change, and, just take what you can do now, try one thing at a time, lock that in, and then try the next thing. And I think you'll really be surprisingly, pleased of what can happen.
Amazing. Tell everybody about your clinic and how they can get in touch if they want to work with you guys or follow you guys on social media.
Yeah, so we are the California Center for Functional Medicine. Our website is ccfmed.com. We have a variety of different social handles you can find on our webpage. Give us a call, check out our content, whatever feels appropriate. I'm a big fan of just meeting people where they are, and very, very passionate about doing our best to help you or anyone out there who's listening, live your best life. And I do hold space that is possible.
Awesome. Thank you again for coming on the podcast. And thank you for sharing this masterclass on sleep with our audience. I wish the best night of rest for everybody who's listening.
Thanks, Drew. That was a really fun deep dive. Thanks for having me.
Hey, YouTube, if you enjoyed what you just saw, keep watching for more great content on how to improve your brain and your life.
For me to first understand what is driving and motivating my wife, my best friend, what are her goals? What are her aspirations? What make her happy? What makes her feel good? And not